We now come to the motion on medical cannabis under prescription. Sir Mike Penning to move the motion.
Thank you very much indeed, Madam Deputy Speaker, and it's a real privilege to stand here to represent families from across the country and with colleagues from across the House who I'm sure will be scampering in all haste when they realise how fast the previous business has moved on. And this gives us a suitable amount of time, some 5 hours, to debate something which is really, really serious. Madam Deputy Speaker, on the 8th of April, Mr Speaker granted me an urgent question with support from other colleagues across the House on the medical use of cannabis, and in particular when a young lady's medical cannabis had been removed from the family's possession when they came through customs at Southend Airport in Essex. The young lady concerned was a lady called Tegan, and Tegan's family are ardent campaigners, and they know, because they've been abroad and had the cannabis medical oil given to Tegan, that it had a really helpful effect. What had an even more dramatic effect on Tegan's family is probably not unexpectedly when Border Force confiscated the oil. I don't blame the Border Force and the Home Office, and we'll go into the history of how we've got to this position in a moment, but they were doing their jobs. However, after long conversations on the phone that evening and with conversations with the Speaker, I was really, really pleased when we got the UQ. The UQ meant that this House could come together and ask the question why. Why could it was an oil which had been prescribed. Admittedly, it was prescribed abroad, but it was prescribed, taken away from a young lady that desperately needed it because of the seizures that she had, because of the epileptic condition that she has. The oil was taken away. It was promised to the family, quite rightly, but it was promised that it wouldn't be damaged and it would be kept in a safe place. On the Saturday after the UQ, so a week later, a prescription was accepted by the Health and Social Care Department and the Home Office, eventually. And I say eventually, because the confusion around this medical product, prescribed medical product, is fascinating to me, even within the medical profession. The first prescription was rejected, and she wasn't allowed to have the oil back because it hadn't mentioned the word oil in the prescription. Even though the description of what the product was absolutely accurate, it didn't have the word oil. A new prescription was issued with the word oil, and it was released. And Madam Deputy Speaker, believe it or not, conversations took place as to who was going to pay for the transportation of that medical oil to Tegan. I naturally will give it.
Grateful to give it. Can I congratulate him and my colleague, my friend from the Gower as well, for the work that they've done on behalf of the APVG and on behalf of my constituent Bailey Williams and his family. And his mother has written to me about today's debate. She unfortunately can't attend, but to say that Bailey really needs urgent access to medical cannabis because of the continuing effect his constant seizure activity is having on him. Does he feel as frustrated as I do that many months after the government first indicated that this could be prescribed, that he's having to describe what he's describing now, and I'm having to once again raise Bailey's case here on the floor of the House?
Wonderful friend for his intervention, but that's what we're here for. Yes, we're frustrated. Yes, we're angry. But actually, we're here to do something which is really very important. And the only reason that the Home Office deregulated this drug, and we're in this position today, is because this House came together. And more importantly, bear with me, but more importantly, the families came together. Families that have got young children, and I'm a father myself, like lots of colleagues in this House, and said, this is fundamentally wrong. Why is it illegal? It helps my child. And we know it helps my child. So that's why we're here today. I'll give way to my friend.
Well,
Am I right, therefore, in my assessment, that ministers have bent over backwards? We have acted in this chamber to ensure that these products are now available, and the problem is in the medical profession. And now what more can we do? I know it's interfering in the medical profession, but frankly, that's now becoming necessary.
I thank my friend, and he's absolutely right. The Secretary of State stood at that dispatch box following the urgent question and laid out in plain English that it is not illegal for a suitably qualified person to prescribe these medical products. So how are we still here? Well, perhaps as I go through the speech.
Could I interrupt you before you continue?
If I can, for a second, I'll give way.
Thank you very much. Because when we heard the Home Secretary make this initiative, we all thought those whose children were doing themselves, or the fits were in effect ruining their children's lives, would actually now, from now on, would actually find solace. Not for those whose children were beyond help at that stage, but in the future. Given that we want it, given that the Home Secretary wants it, given that the parents want it, given that the individual doctors want to prescribe, there is clearly some group at a regional level, isn't there, in the Department of Health that is actually stopping these prescriptions being issued in a way in which they can be delivered.
Many of the points that the Right Honourable Gentleman has alluded to in his comments, I'll touch on in my speech going forward. And the person that was ever so helpful was the Home Secretary, was ever so helpful was the Health Secretary, but actually the Prime Minister played an absolute diamond role in this, because we took Alfie Dingley and Hannah Deegan to number 10 with the petition. And I know, Madam Deputy Speaker, we're not meant to refer to the gallery, but they're up there and they're watching us, and they were scuttling up the stairs very quickly as well. So for me, I think it is vitally important that over the next 5 hours we can have a proper debate this afternoon without concerns about time limits. If the government lose their business at time, I'm not fussed. You know, so I can certainly write on, gentlemen, there is government business later on. There's the remaining state, so there is government business. I don't care about that. What we need to do is try and flush out what are the blockages, which is what the Secretary of State for Health and Social Care tried to do. Anyway, I will try and make some progress.
I'm very grateful, and he's in responding to another intervention, he's indicated that there is a degree of resistance within the NHS amongst clinicians. But does he not agree that it's not just that, it's the regulatory framework set by the government that is restricting access to this medication, and that we're still left in a situation where many people in acute pain are resorting to opioids, which are highly addictive and potentially fatal, whilst not being able to get access to cannabis legally, which can often ease their pain?
My honourable friend and we debate very often around health issues, and he was my shadow, I think, when I was the Shadow Health Minister, and we agree on most things. And this particular issue around prescribed medical use of cannabis, pharmaceutical, we agree. The other area, which I think he was alluding to, is not, in my opinion, for this debate. It's not on the motion. And the reason we've managed to get such huge cross-party support from families and around the country on this specific issue of prescribed medical use of cannabis is because we've stuck to that and not gone into the casual use. I'm going to make a little bit of progress if I can, and then colleagues will have plenty of time. And I'm really chuffed that the Backbench Business Committee gave us this opportunity. And whenever the Backbench Business Committee had 5 hours for a debate on a Monday afternoon, I am simply thrilled, and I intend to use as much of that time as possible. I got a little note, just anecdotally, I got a little note from the clerk saying that you should speak for 12 to 15 minutes, Mr. Penning. Yeah, in your dreams. The key for me, touching on the point, and I will come back onto this at the moment, is that there is a blockage in the health, the NHS. Let's talk about the NHS. There is a blockage if you can't pay for this prescription. If you can pay for the prescription in the private area, there are consultants working inside the NHS and outside in the private sector, but private prescriptions are being honoured. The product is available in this country, perfectly legally, if you can afford it. And that is something that sticks really strongly in my throat, which I'm sure we'll come on to later on. Madam Deputy Speaker, at the UQ, at the conclusions, I think, to the UK, even though it's not in Hansard, I clearly heard the Speaker speak to the Secretary of State for Health and Social Care, saying that whatever happens, we're not going to leave it. He was referring to me. We're going to go on and on and on about this until we get justice for these young people. And touching for a moment beyond the small cohort of desperately ill children, there are others in the country that would clearly benefit from the medical use. And I'm not a doctor, but I've had hundreds and hundreds of families that have come to me and said, does this mean we can get some help for us? From the MS Society, who have sent an excellent briefing to colleagues today, to the Brain Injury Trust, to many, many others. Constituents come into my surgery. And I have said what we need to do is make sure that your specialists, that are the experts in your area, are saying that you need it, and then we can fight your corner. We have such specialists in this sector now. For children with epilepsy, young people with epilepsy, my constituent has just triggered over 18, so a mum would want me to make sure that I talk about post-18 as well as pre-18, that do get a tangible benefit in their seizures and they have from these prescriptions. From this prescribed pharmaceutical specialist, pharmaceutical provided, so we know exactly what's in it, and yet we still have the crazy situation where hospitals are telling parents that if they bring it onto a ward where their child is ill as part of their ongoing medication, social services will be called to look into what they're doing with their family for a prescribed product from a consultant. My own constituent, who has just turned 18, when I wrote to her GP on behalf of the family and to the CCG who were blocking it, they said, we're not interested in homeopathic products. What on earth is going on inside the medical profession in this country when we haven't been able to get out there what the product... And by the way, Madam Deputy, if they don't know what it is, go and ask someone before you write stupid letters back to people and break their hearts. Because I had to send that letter on. And then actually look carefully at what we could do to help. It is not for any politician in this House, Madam Deputy Speaker, who is not suitably qualified to say to anybody, you deserve to have that product. What we must do is break down the blockages, which is what the Secretary of State alluded to in his speech on the UQ. Bear with me a second, I'll give way to him. Is to break down and find out why. And I'll come on to that again in a second, Madam Speaker.
Thank my right honourable friend for giving way. As he knows, he and I share a passion on this subject. Would he not agree that the absurdity that lies at the heart of this situation is that we have heroin prescribed legally as morphine, well understood for many years, but somehow, when it comes to cannabis being used for medical purposes, a kind of medical prejudice kicks in, even though we have morphine. And does it not highlight that there is an inconsistency here that needs to be addressed and addressed quickly? Yes.
And I completely agree, my friend, and he is Tegan's constituency MP, which is I was referring to in one end. She got, as he knows, her medication 7 days late. But I'm convinced she would not have got that if we hadn't got the UQ in this House, which is why this debates and these sorts of things. And UQs, Madam Deputy Speaker, and, you know, I used to be a minister in government as well, and I was always panicking about whether there's going to be a UQ, whether there's not going to... I always actually said, look, why don't we just do a statement? It's damn so easier and we can control the agenda going forward. The business managers didn't always agree with me on that point. Can I just correct the record? It was a brain tumour charity that have sent an excellent briefing note to me this morning, not as I alluded to earlier on. Now, if we look, Madam Deputy Speaker, at the only, I may be wrong, but as we've, in our investigations, the only NHS prescription that has been issued was actually issued through the Home Office, Madam Deputy Speaker. Because Alfie Dingley got his medication through the panel that the Home Secretary set up with the expert group in the Home Office. So since we changed the law subsequently on that in November, as I'm aware, no NHS prescription has been honoured. We've had trusts clearly threatening consultants not to do it. We've had their professional bodies do the same, and I've seen some of the correspondence that's been out there. As I alluded to earlier on, we've had families threatened with social services if they brought the product into the hospital where their child was being treated when it was a prescribed prescription drug which is perfectly legal in this country today. So the real issue is why, Madam Deputy Speaker, if you've got the money, got a donor, you've crowdfunded, or in my case, from my constituents, one of the manufacturers has given it to my constituents free because there's no way in the world that she could afford to do that. And I thank them for doing that, particularly from the family. Can that happen? So if you can afford it, or you get a donor, you get it. And in the country that is so proud of the NHS, how on earth have we got in a situation that if you're poor, you don't get it? I give way.
I'm very grateful, and I agree with the points that he's making. But the fact that the one prescription that's been issued has been through the Home Office raises an important point, doesn't it? That the Home Office should have nothing to do with what is a health issue, and it should be transferred without delay by the government to the Department of Health.
Well, to be fair to my friend, it has been. And this was before we changed the law in November. So the panel that the Home Office set up while we looked at the change of the law, and frankly, it really doesn't matter, but at the end of the day, there's a health minister at the dispatch box, there was a health secretary there for the UQ, it's clearly sitting in there. However, the connotations are still there with, for instance, bringing it into the country. But licensing, I understand that, but it's moved, this drug has been moved out of its category into the fact that the Home Office, into the Health Department, and it can be prescribed. The issue is not prescription. Even though there's a very limited amount of private prescriptions, but they are being issued, and I thank the consultants that have met with me and my colleagues from across the House that have been campaigning on this, and they are willing to do it. The blockage, as far as I can work out, is that this was moved too fast, too quick, to help the families that we wanted to help, when actually the Health Department and the Home Office wasn't ready. Which actually fascinates me, Madam Deputy Speaker, because 2.5 years ago, no, 4.5 years ago, I've been a minister, I stood in Westminster Hall as the minister responsible for drug policy and said then that the government was minded to allow medical use of cannabis under prescription. Do they not read our debates? Do they not listen to what ministers have got to say? And whether they thought I was having a flyer there and as a Minister of State just doing it just because I felt kind that day, actually the then Home Secretary is now the Prime Minister, and of course I did it, of course, with her permission. I give way.
What did ministers do after my honourable friend made that point in Westminster Hall? He says that was 4 years ago. Why did it take until last year for the government to do anything about this?
You should have seen, Madam Deputy Speaker, the reaction of some of my civil servants when I got back to the Parliament after making that comment in Westminster Hall, and you'd understand exactly why it went absolutely nowhere after I said it. Even though I pushed and cajoled, actually it went out. And sadly, or fortunately, I was moved to the Ministry of Defence after the 2017 election. So, Madam Deputy Speaker, why are we here today? Why have colleagues come into the chamber, which was completely empty 10 minutes ago, 15 minutes ago, absolutely empty, when colleagues probably could go. I don't think there's going to be a vote.
Steady.
And the reason I don't think there might not be a vote is the government have indicated to me that they've accepted the motion, which is votable if we needed to. And I've indicated to the whips that if we needed to, I would push it to a vote. But I don't think we need to, simply because at the end of the day, once we've listened to the debate, the Minister will realise, hey up, we've got to move faster. Are we moving fast? No. Are we moving faster than we was? Yes, but there's more that needs to be done. And why is that, Madam Deputy Speaker? That is because young people are having massive seizures that are affecting their lives, of them and their loved ones, affecting their families and the quality of life that they are having in this country today. We can do something about that. We're on the journey of doing more about it. But I find it, as a father more than as a politician, why is it that they have to go to Holland or to Canada, find some money? If they can't find the money, you ain't going to get it unless someone donates it to you, or we crowdfund. In the 21st century, why are we allowing these children to be given drugs that are not working, that were never designed for the use they're given? While we have products out there that are being produced by pharmaceutical companies, we know exactly what's in the product, and it may not help. It may not stop those seizures, but in some it clearly does. And it is morally wrong for us to sit back and allow those children to suffer, and I have no intention of doing that going forward.
Frank Field.
He's taking an intervention. On the question of the unsatisfactory position he's now described, and people going to Holland, families desperate going to Holland to buy, couldn't the Home Secretary today say that he's instructed the Border Force not to prevent anybody from bringing those drugs back into this country?
I say to my friend, and actually, at this point, something I forgot to do during my commentary. Can I play tribute to him? Because we did some questions in this House prior to the Secretary of State at the Home Office changing his decision. And I think some of the things that he kind of goaded me into that I want to do. There was a very important debate going to take place on Europe on the Wednesday, if the Right Honourable Gentleman and colleagues remember. This was on the Monday. Alfie Dingley and his family were going to Holland on the Wednesday. I said that him and I, Right Honourable Gentleman and I, would go to Holland with Alfie Dingley and bring it back, and if we was arrested, so be it. I think the government might have lost that vote had we not changed the law in time. I don't think that matters. Actually, what I think matters is that Alfie got his medication. And answering the specific point, yes, with a prescription, if it's been brought, and we're still in Europe, European prescriptions, I understand that are as good as ours. Who knows? But I'm told they are. Actually, if they're being bought per prescription, it is seriously wrong to take that product off a young child.
The question is, as on the order paper. Jeff Smith.
Thank you, Madam Deputy Speaker. Forgive me for shuffling my papers. I wasn't expecting to be called quite so early in this debate. I'm very grateful to be called early, but just bear with me. Firstly, can I just congratulate the Right Honourable Member for Hemel Hempstead and my Right Honourable friend, the Member for Gower, on securing the debate, and for their brilliant campaigning on this issue and their co-chair personship of the APPG on medical cannabis. And can I also congratulate the campaigners, some of whom are with us today, who've brought this into the public eye over the last year and are determined to make sure that it remains in the public eye. I certainly will.
While he's gathering his thoughts, I also thought that perhaps my honourable friend, the Member for Gower, might have been called next. I think that's probably what was in his mind as the co-chair of the APPG. And I was going to intervene on her to correct myself from my earlier intervention, in that I see that my constituents, Rachel and Craig, who are the parents of Bailey Williams, have managed to attend today, despite the fact they thought they couldn't because of a medical appointment for Bailey. And it just gives me the opportunity to pay tribute to them for their relentless campaigning on his behalf. And it's because of people like them that we're all here this evening.
I'm delighted to give way to my honourable friend to pay that tribute to our visitors today. Can I just start by reading extracts from 2 letters from a constituent of mine who has asked me to keep his name confidential. I'm happy to give it to the Minister on a confidential basis. He first wrote to me in September last year on this issue, after the government had accepted the principle that we should be able to prescribe medical cannabis, but because the decision had not been fulfilled, the aim had not been fulfilled. And he wrote then, "I have a grandson who suffers from a severe form of Crohn's disease. He is in constant pain and finds his present regime of opiate-based painkilling has difficult side effects. He tells me that his consultant doctor is willing to prescribe the cannabis-based alternative as soon as it is permitted. My grandson has never obtained cannabis illegally and does not intend to do so." That's a Crohn's disease patient. Now, my constituent wrote again to me in April of this year, and things had moved on. But I think this probably illustrates the problem. So he wrote in the second letter, "The position in my family is now relatively fortunate. Left in limbo for a long time by the NHS and enduring frequent nausea and serious debility, my grandson used his own initiative. He found a private doctor specialised in pain control, a highly respectable man, formerly an NHS consultant, who gave him a prescription for a cannabis product. This has been successful. His symptoms are under control, his general health and capacity to eat are much improved, and he's being phased back into his job, which he had been likely to lose. I am meeting the financial cost to the tune of £695 per month currently. By tightening my belt, I can do it, at least for a reasonable time to come. I never spent money to better effect in my life, and I'm so grateful for medical science. But some of the sufferers on the programme have no financial resources, and for an old socialist like me, it goes against the grain to use private medicine. Now, Madam Deputy Speaker, you don't need to be an old socialist to think that this is an unacceptable situation. It is.
I don't think I'm an old socialist.
And the right honourable,
you will be, don't worry.
the right honourable member for Hemel Hempstead, who set out the case and the issue before us here very, very well, certainly is not an old socialist. And as we heard from him, there are multiple examples of patients who want to access medical cannabis, including those whose doctors want them to access it but are not able. These are patients who were given hope last year of an end to their pain or their anxiety or their seizures, only to have it dashed and frustrated. I'll happily give way.
Very grateful to my honourable friend, but like many honourable members, I've had parents contact me recently whose children, they are desperate to try and obtain treatment for the children, but they have said to me that they feel, if anything, the situation has got worse since the guidelines were issued, and they completely fail to understand how that can be. I wonder if that's his experience, and you know, whether he believes that we can convey to the Minister today that there is a really powerful sense that hope was raised and has been dashed.
I think my honourable friend makes a key point here, because those hopes were raised, and there are situations where people were promised medicine and have not. That promise has not been delivered upon, and it's a source of great frustration.
I'm really grateful to my very honourable friend for giving way. I can't quite understand how the mechanics work if you get a private prescription and you remain in this country and you get the drug, but if you get a National Health Service prescription, it actually doesn't work. How can we have a system whereby you go to a private doctor and you can go to a chemist who will provide NHS drugs, but also will do a private prescription? Who's preventing them from giving the same prescription to somebody who can't afford, like this great socialist who's paying money for his grandchild.
That, I think, is the key question I'm just going to come on to. I think what is the root of the problem, which is this is not an illegal prescription. This is a legal prescription.
Legal, yes.
But our NHS is unwilling or unable to make these prescriptions and to deliver on them. And the question I think we need to ask today is what can ministers do, what can government do to help sort out the situation? What can we do? Because clearly it's not good enough for us to say, well, as Parliament, as legislators, we've done our bit and it's now all down to the medical establishment, because clearly this is not working. The government has made, I mean, the root of the issue, it seems to me, is the evidence, and the government has made a call for a research on this, which is fine as far as it goes, but we need to look creatively, because research and evidence take different forms. And maybe I should just also quote from another letter that the minister, I received from a minister when I wrote to a minister on this issue, who said to me, cannabis is legal to be prescribed, but should only be prescribed where there is clear published evidence of benefits. Now, that in itself, that first little phrase, is difficult, because when cannabis has been in Schedule 1 up until very, very recently, it has made research incredibly difficult. When a drug is in Schedule 1, it's very difficult to do research on it.
You cut our drug bill in half if you applied that to all medicines, wouldn't you?
That's a good point. So the cannabis should only be prescribed where there's clear published evidence of benefit, and there's need, and where established treatment options have been exhausted. And my question is really to the Minister today, do we really think all those hurdles are correct? Because if the best treatment is cannabis for a condition, we shouldn't have to exhaust all those other options. We should be able to trust our clinicians to prescribe in those circumstances. And the root of the problem is this lack of confidence of clinicians to prescribe. And the biggest barrier is around concerns about worries over the evidence. And the government's called for a call for evidence and call for research, but it's insisting on randomised controlled trials, and this is what bothers me greatly. I'm really concerned about the insistence on evidence from randomised controlled trials to the exclusion of other means or other ways of gathering evidence. And what I would do very, very strongly is to advise ministers and others to go back and look at some of the evidence given recently to the Select Committee by Professor Mike Barnes, who's a noted expert on this subject, and he's himself has produced a study of the evidence for the efficacy of cannabis for a variety of medical uses. And there is plenty of evidence around the world for the efficacy of cannabis for medical use. But because this evidence has not been produced in randomised controlled trials, we are not accepting it. And so, I'm going to quote a little bit from Professor Barnes' evidence to the Health and Social Care Select Committee, because what he's saying is that we're trying to force cannabis into a particular pharmaceutical route in terms of trials when it's not an appropriate way to go. And what he said is, in his words, cannabis is not just cannabis, it's a whole family of plants. And it doesn't really lend itself well to a standard pharmaceutical approach. There's not a single molecule that you can compare against a placebo. Instead, we've got 2,500 varieties of cannabis, each with a different structure, each with subtle differences, each interact with each other differently. So which one of those do you pick for your standardised, randomised controlled trial for a standard pharma model? And what he's saying is we need to take a range of other evidence into account. So we need to take anecdotal evidence into account. When there are tens of thousands of anecdotes that build an evidence base, there is substantial anecdotal evidence of the efficacy of cannabis for medical approaches around the world.
Will Honourable Friend give way?
Yeah,
I thank Honourable Friend for giving way. Is it not also the case that we're not just talking about therapeutic uses, we're also talking about pain control uses, and that there are many conditions where pain control is actually the most important use for a medication? And can I just add that I think that a lot of the work that was done by the former member for Newport West, I think I would like to give my recognition to the work that he did as well.
Yeah, I think what's the phrase about standing on the shoulders of giants, and we think we'd all admire the work that was carried out by Paul Flynn over many years on this. So anecdotal evidence. I don't understand why the government won't also, at the same time as calling for randomised control trials, also look at observational trials where you can get people actually taking the medicine that they need and seeing how effective it is. We need an audit of those already using the medicine to see what's happening to them. And those could be in addition. There's nothing wrong with randomised controlled trials, but the complexity of cannabis as a product makes those very difficult to carry out. So we can have those, but there's lots of other ways we can gather evidence on this issue that will enable us to move forward. Yeah, happy to get away.
On trials, is it not the case with other diseases and drugs we have been flexible on trials? And I think particularly of the flexibility after campaigners fought around HIV, getting the drugs to people that were terminal before trials had finished, because there was an understanding that the harm of the disease was far greater than any side effects could possibly be. And that is how we should be treating this issue as well. We understand the risk is relatively low, although there might be some, but the potential gain is rather great.
My Honourable friend makes an excellent point, and yes, there may be risk, but we look at the risk of some of the other treatments that we're using. Opiate treatments are much more risky than cannabis. So we need to find another way. We need to take into account the different types of evidence. We need really a bespoke medical response to this. And I just ask the Minister, how can we use the different types of evidence to get an evidence base that will satisfy government and satisfy clinicians for a way forward? How can we use, for example, the Access to Medical Treatments Innovations Act, which was passed a couple of years ago? So we need a bespoke medical response. We also need, in my view, a bespoke regulatory response to cannabis. And I suppose the question for the Ministry is why not? Other countries have done it. So the Netherlands, Germany, Canada, they all treat cannabis differently to other products and other treatments. Holland have set up an office for medical cannabis to deal with the complexity of the issue, and I don't see why we can't do something similar.
Would my friend give way again?
Yeah,
I'm very grateful for him giving way again. And just to follow up on the excellent point made by my honourable friend, when we're talking about, in many of these instances, including my constituent, children who are suffering multiple seizures, who are, as a result of that, that's impacting on their mobility, on their weight, on their muscle tone, on muscle wastage, and putting their lives at risk. Isn't it quite strange that that balance of risk doesn't seem to be taken into account when considering prescribing this treatment?
It's absolutely right. There seems to be it's like almost like an irrational fear about the risk of cannabis compared to the risk of some what you might call more conventional treatments that we're already using.
Sorry, I'm not going to speak in the debate, but isn't it true? Isn't it true that for all the evidence that have been sent in to us by parents, nobody's written in to say, I've used the drug and it's made them worse. Yeah. All the evidence shows it either has no effect or it's a radical improvement.
Honourable makes an excellent point. And he's absolutely right. There's hardly any evidence. Well, I'm not aware of any evidence of this making the product making it worse. In fact, if you look at, people have been using cannabis for thousands of years. If there were really these worries about the side effects, I think we would probably have seen them by now.
He's touched on a very important point, and I think this is right. Because we're talking about pharmaceutical prescription drugs, that risk has been relatively alleviated. There is evidence of people using cannabis in a casual way that does have an adverse neurological effect. And that's why the whole debate and this whole campaign had to be separated from that, so that it is prescribed use. There's a separate debate to do with the casual use, and he's absolutely right. People have used it for thousands of years. Some people think it's very great, other people don't. For me, this was that we know exactly what's in the product that's been given to the patient.
He's absolutely right, and it points to this other issue about where you get your product from, because the problems that are allegedly caused and are allegedly linked to increased episodes of psychosis are from high THC street cannabis, which is not what we're talking about when we're talking about medical cannabis products, which usually, no, I mean, as I said, there are lots of different types, but there can be, generally speaking, they're quite very often CBD based, but when there's THC in them, which is the psychoactive element, it's a relatively small amount compared to, in fact, compared to street cannabis, it's much, much smaller. So it's like apples and pears, really. And he makes a really, really important point. I think I was talking about the evidence from around the world, which we need to look at. I mean, I'm not going to go into great detail, but let's look at how we can learn from evidence in those countries, the countries that have got I lost my notes again, excuse me. Let's look at the countries like Netherlands and Germany and Canada. Let's also look at the evidence in the countries that have successfully, the other countries that have successfully introduced medical cannabis regimes, such as Australia and Denmark, where it is working. And I suppose my question to the Ministry is, what work is the government doing to learn from the experience of those other jurisdictions? Because there are currently at least 138 trials worldwide on medical cannabis. We need to take into account that global evidence. And we also need to ask, there are a number of questions I'd like to ask the Minister. So why can clinicians make individual decisions on certain conditions, but not others? So for example, clinicians can make individual decisions, like my constituent's grandson on Crohn's disease, on a case-by-case basis, but not for some other conditions. So we need a scoping exercise to look at how we can enable patients to get this medicine now, because if not, and this is I think the key issue, there are something like, the estimate is something like 3 million cannabis users in the UK, and an estimate is that around about 1 million of those might be using it for medical use. Now that may be a high, but whatever figures you use, there are hundreds of thousands of people using cannabis to alleviate some kind of pain or to help with a medical condition. And at the moment, they get their product from the street or from the illegal trade. Now, I don't think that is good for them, and it's not good for society. And that I think is the key point. We already have people who are using cannabis for medical reasons, and they're getting it from illegal suppliers.
Driven to it.
Yeah.
Thank the Honourable Gentleman for giving way, and he's making an excellent speech. And on the point of individuals using cannabis medically from the street for pain, I had a visit to my constituency surgery from one of our veterans who had incurred an injury during his service, who was in chronic pain and felt that cannabis alleviated that, but really didn't wish to buy it on the street, wished it to be prescribed, and wished for the Minister to look at research and studies to ensure that where veterans do need that assistance, that they can have it.
And that is not an unusual case. There are lots of people who want to use medical cannabis and don't want to buy it from the street, and don't want to have to go to Holland to import cannabis products from abroad, and they're frustrated in their ability to do so as well. I'm going to wind up because I've been speaking for longer than
you've been generous.
I intended. So, on the funding issue, there are reports, there are cases of clinicians being willing to prescribe but being blocked by trusts or CCGs. Now, ask the Minister, what is her understanding about that? About how many cases where funding is the issue rather than the prescription? Because I think it's an understandable thing, because even where where there are people willing to prescribe and there is new thinking, CCGs currently don't have budget lines for some of these products, so you can understand the reluctance. So I'd be interested to know if the Minister has any information on that. But on the cost thing, yes, it might cost. It might cost more for the NHS to supply more medical cannabis prescriptions, but we have to look at, in comparison, at the reduction in other costs. So the estimate is 25% smaller, fewer opioid costs, and of course fewer hospital admissions. And Professor Mike Barnes, in his evidence to the Select Committee again, said that you could probably introduce medical cannabis into this country on the NHS at no net cost when you take into account the reductions in costs elsewhere. I'm going to finish, Madam Deputy Speaker, because I just want to close by saying this. We have a system which is clearly too restrictive. It's not working. We need some creative thinking. We need some flexibility from the government to look at different types of evidence from around the world, which is there. Because there are people in this country who, if they were living in Holland or Australia or Canada, would be able to get on with their lives, get their cannabis products legally, and wouldn't have the worries that many of the campaigners in our gallery today about their children or their relatives having to go through either chronic pain or going through the episodes of epilepsy that we've seen in some of the young patients over the last year. So I think all of us, we all want to make some progress, and we're all desperately frustrated that this is not, we're not being able to get anywhere. So I would just, again, refer the Minister back to that evidence from Professor Mike Barnes to look at what other types of evidence we can get to inform ourselves of a way to deliver the products that our patients need into their hands. Thank you.
The Honourable Gentleman made reference to the late member for Newport West, and the House will remember fondly that the late Paul Flynn raised this subject in this House persistently over many, many decades and got very little support. I keep looking behind me expecting to see him there in his usual place, and the Right Honourable Gentleman says he's watching us. I have every confidence that he is, and I'm saying on behalf of the whole House that we remember him fondly. Crispin Blunt.
Thank you, Madam Deputy Speaker, and it is of course a pleasure to follow my fellow co-chair of the All-Party Parliamentary Group for Drug Policy Reform, and he and I followed the Honourable Member for Brighton, but of course Paul Flynn as were our predecessor co-chairs. And Madam Deputy Speaker, you've quite rightly made the point about the incessant campaigning that Paul Flynn made on this issue, and he was tragically shouting from the outside to an establishment that chose not to listen for 4 decades in this House. And I am determined in the remainder of my time in Parliament is to devote as my priority issue outside all the things that affect Reigate and the nation to drug policy reform and obtaining the benefit for British patients of medicine from cannabis is an enormous potential public good. And Madam Deputy Speaker, in drawing also the attention to the House of my entries in the Register of Members' Interest, I welcome the Minister to her place. And I know that it's her colleague, the Noble Baroness Blackwood, who owns this issue at junior ministerial level in another place within her department. But it is critically important that health ministers understand the potential benefit as this medicine from cannabis is developed, and also understand the potential economic benefit for the United Kingdom if we take a leading place in this industry. And we have the opportunity to do so because we already do. And the Minister will, of course, be aware of the difficulties the Home Office had when they managed this issue. My right honourable friend, who I congratulate for his setting up of the APPG on medical cannabis by prescription, and the Honourable lady from Gower for their leadership on this issue. But the first urgent question on this issue was asked about Alfie Dingley by me, and it was the fact that he was sitting behind me at the time when I asked the urgent question, when he indicated his support on this issue and that he thought he had begun to open up this issue in the Home Office, that we had the absurdity that that question was being answered by the Police Minister, who had been handed the responsibility at 24 hours' notice from the Drugs Minister in the Home Office, who has had no particular interest in drugs from a health perspective, but actually it was about protecting the public, obviously, is the Home Office's responsibilities, because her husband, associated with British Sugar, who supply the cannabis for a great potential British success story in GW Pharma, who are one of the global leaders in producing medicinal cannabis, just not for the British people. And that's something that we need to change. But I want, Madam Deputy Speaker, if I may, to really put this issue in its global perspective and in its historic perspective, because unless we understand why there is such a lack of understanding over this issue, and why we are so behind in the research around medical cannabis, and why the medical profession are so intimidated by it, then I don't think we're going to get the necessary pressure from her and her colleagues to continue to push for the necessary advance in this area. Now, we need to go back, Madam Deputy Speaker, to understand that the reason we are so far behind sits in racist American policing from the 1950s. And that is the reason that cannabis, in the 1961 UN conventions, was put in Schedule 1. And in an area, because, frankly, African Americans smoke this stuff, it was obviously ghastly and very dangerous, and in total disregard of the science and the evidence, we then found that it was put in Schedule 1, which meant there has been, as we heard, no research. It's been extremely difficult to do research on the benefits of medicine from cannabis. And the irony that we have had for obviously an extremely long time, medicines from opiates, standard medical product, yet medicine from cannabis was therefore put beyond the bounds of research. And indeed, GW Pharma owe their leadership in this area to a license issued by the noble Lord Boateng when he was the drugs minister in the late 1990s, in exceptional circumstances, to enable them to conduct research into medical cannabis. Now, that at least, that decision has then been followed by £1 billion of investment in GW Pharma. And what I want the Minister to understand is it's not only GW Pharma, it is now a number of billion-dollar companies in North America, particularly in Canada, but also in the United States, who are now investing in this area. There is, frankly, a tidal wave of investor money coming into the medical cannabis business and also, to an extent, the recreational cannabis business. But obviously, it's the medical cannabis business that we must focus on. And we need to ask ourselves why. Why have so many people who are making a decision about money choosing to invest in the potential of this product? And when the Honourable Gentleman from Manchester, Willington, and I became the co-chairs of the All-Party Parliamentary Group for Drug Policy Reform, joining the noble lady, the Baroness Meacher, as the three co-chairs, and I want to pay tribute to the work that she has done in reform in this area. She emphasised to us the need to focus our efforts on developing a legal change around medicinal cannabis. And in 2016, that all-party parliamentary group had commissioned a report from Professor Mike Barnes, about whom we've already heard, to identify what conditions across the world medicine from cannabis had been established to a medical standard where the medicines would apply. And it was epilepsy in children, spasticity associated with MS, and as an antiemetic if you're undergoing chemotherapy. Now, for those conditions, it was, by 2016, already established globally to the highest possible medical standard. But of course, what I want to emphasise to the Minister, that the potential application of this is very, very much wider. And the problem we've got is that the science and the research base is in its infancy, and it's in its infancy because we put it there by stupid regulations driven by racism out of 1950s American law enforcement, which then were into the treaty in 1961, which put cannabis in Schedule 1. And the Minister will know that the NICE guidelines that are going to be coming out are going to focus on 4 indications: chronic pain, multiple sclerosis, treatment-resistant epilepsy, and nausea and vomiting due to chemotherapy. But there is substantial evidence, and enough evidence to excite investors all around the world to invest billions of dollars into the potential of this medicine, is that cannabis or cannabinoids will be effective for chronic pain in adults, for spasticity symptoms in MS, obviously for chemotherapy-induced nausea, and evidence that cannabis or cannabinoids will be effective for improving short-term sleep outcomes in individuals associated who have deep sleep disturbance, improving clinician-measured spasticity symptoms in MS, improving symptoms of Tourette's, improving anxiety symptoms in individuals with social anxiety disorders, and improving symptoms of PTSD. And if you start adding anxiety and depression to those lists, I hope the Minister will understand that if we advance the science satisfactorily in this area, this is of potential vast application. And here we have to understand the range of interests arranged against development of medicine in this area. And there is an interesting example, Madam Deputy Speaker, and it's really associated with how policy has been developed here, both in North America and in Germany, and indeed here, is that it hasn't come from the medical profession or the pharmaceutical industry. It's come from outside. In the United States, the states that have approved the use of medical cannabis have usually done it, started off the process by a referendum that has then imposed the answer on the legislatures in the individual states. And that has now been the case of 12 states, where they've then moved on from the 25 who have got medical cannabis, who have now also established a market for adult use recreational cannabis, alongside, of course, the very important development in Canada, who have had medical cannabis for some time, but last year introduced a legal market for legally supplied cannabis for recreational adult use. And I quite understand the political need reflected in the establishment of the APPG for medicine from prescribed cannabis, and honestly, it's the name in the names of the co-chairs for whom this debate is in their names, to differentiate between medicine and between recreational adult use. And of course, we must focus on the medicine first. There is a separate discussion to be had about the important criminal justice benefits and the important societal benefits and the important public health benefits that come from being able to protect the public and protect children from a legally supplied and properly regulated and licensed legal market. But that is a separate set of discussions. But what is absent and has been absent in the wider political debate about all of this to date is a proper consideration of evidence. And it's why we're 50 years behind, because we haven't been able to get the evidence because of the policy imposed, as I said, from the 1961 Convention, which is why the potential benefit available to the public is we're so behind on. And this is why I want to draw the Minister's attention to one potential application here around the chronic pain. The United States are now coping with an opioid epidemic. Last year, 63,000 Americans died of an opiate overdoses, which started in the doctor's surgery. These weren't junkies on the streets. These were people who went to their doctors to get treated for chronic pain, and many of them, of course, were prescribed OxyContin, courtesy of Purdue Pharma, in circumstances that are now subject to a class action. But when one considers, Madam Deputy Speaker, that in the United States, that in the state of Arizona, where there was a referendum on the legalization of cannabis, that this referendum was teed on a knife edge. Not very clear who was going to win, and then right at the end, I'm advised there was then a substantial slug of money on this referendum in order to get a no result, which was achieved. And nobody knew where the money had come from at the time. And then I understand that it actually came from a business associated with the rehabilitation of opiate addicts. And that is truly shocking, that in order to prevent the opportunity for cannabis-based medicines to replace the very much more dangerous opiate-based medicines that have contributed to this terrible level of dependency in the United States about a medicine that is profoundly dangerous if taken wrongly, then led to an influence to try and keep cannabis out of the business. So what I want to say to the Minister is I am anxious for the Department of Health in taking this issue forward to clearly understand where all the interests are here. And if one begins to roll this forward in the years to come about the potential application here, to understand what opportunities there are for the United Kingdom as a provider of medicine from cannabis. We've got GW Pharma, and they ought to be reinforced by other companies supplying pharmaceutical-grade cannabis-derived products to people for medicine. And if those lists of conditions that I listed earlier, Madam Deputy Speaker, this is going to be a multi-billion-dollar industry, and particularly if we can get a decent slug of the global market as well. But it's not just the economic effect. It's actually about the opportunity cost of people continuing to be prescribed opiates when they could be prescribed a cannabis-based medicine. It's about the opportunity cost of people self-medicating, understanding the benefits that they could get from cannabis. And of course now we're at the stage where the Minister will have seen the report about people who have a medical condition for which they have a diagnosis who now can't get medical cannabis. And of course they're now growing their own. And in certain circumstances they're being arrested for growing their own medicine. Our policy is in a mess, and it's going to need a real drive from ministers to get a grip of all the regulators and the medical interests and the pharmaceutical interests and obviously all the patient interests in order to get to keep pushing for sensible reform here. But I would ask the Minister and her team, look around the world at the other jurisdictions who are leading on this. Look at what is happening in North America, look particularly at Canada, look particularly at the state of New York, look particularly at Germany. In Germany, they've moved pretty rapidly, following a legal action by two self-growers of cannabis to produce their own medicine, where eventually the German state, having lost the legal action against them, which then enabled them to grow their own cannabis, their own medicine, to actually say, what these people need is pharmaceutical grade medicine from cannabis. And there are now, I think 2 years later, 80,000 prescriptions have been written in Germany for people to get medicine from cannabis. We can move relatively quickly on this if we have the will. And if we don't have the will, what we're going to see then is the continuing misery of the families with epileptic children who are chronically ill. And it's quite right that End Our Pain and the APPG have focused on those families, and of course led so brilliantly by the Deacon family and with Alfie and Charlotte Caldwell with her son Billy. They're the ones who pushed this over the line, because no politician can turn around to mothers and families in those circumstances where they have obtained treatment with medicine derived from cannabis and then face up to the cruelty on their return to the United Kingdom of taking that medicine away from them. And of course, Billy Caldwell's case was the one that then drove the Home Secretary over the line when he issued the special licence and then began the process of reform in this area. So I say to the Minister, this House, I can't find anyone in this House who doesn't accept the principle that if we can have medicine from the opium poppy, surely we can have medicine from a cannabis plant. Particularly when there has been no issue. I understand, find me evidence of someone who has died of a cannabis overdose, because I'm told there aren't any. Now, of course, people have died of, in certain circumstances, of the mental conditions that will end up being associated with people who very heavy use, particularly young people, of the kind of dreadful stuff that is sold on our streets by the criminal supply chain that we have chosen by the laws we've passed here to put that business in the hands of criminals who are selling the strongest and most dangerous stuff to our children. No trading standards are going around to measure them and check that their consumers are over the age of 18 when they purchase it. And that's why it's easier for our kids to get this dangerous form of cannabis compared to getting alcohol. And so there's an awful lot of reform that we've got to get to grips with in this area. But the public benefit that could then come from the United Kingdom really pushing on with the science here and supporting the research is huge, frankly, and that's why I think we in this House have got to stay engaged with it. I want ministers to really push and lead on this. But it was a very important point made by my fellow co-chair of the APPG. This is going to have to be a bespoke arrangement to regulate and license and do this system. There is an endocannabinoid system in all animals, and that's not taught at medical school. So there is it's not part of standard medical training or assessment at the minute. But it would appear to be a reason, frankly, why this stuff works at a common sense level. It's why out there, amongst all the people we represent, there is a knowledge that this stuff does work. That's why hundreds of thousands of people are using it in order to self-medicate for the conditions that they suffer. Madam Deputy Speaker, we've got to bring those people in to the legal framework so that they can access the medicines that are going to make their lives very much easier. And the truth is, many of these diseases and conditions that look as though they are likely to be treated with medicines from cannabis are the diseases of aging. And it would be infinitely better if people are using a safe medicine such as cannabis rather than dangerous medicines such as opiates or indeed self-treating themselves with legal alcohol. So I ask my honourable friend the Minister to push her colleagues to make sure that we do not simply follow down a path, a pharmaceutical path that just is assessing medicine as a molecule with a particular individual effect on an individual condition. That is not going to work in respect of medicines derived from cannabis. We've heard the reasons, because of the complexity of a plant-based medicine that has many thousands of different variants once you start spinning them all out. There shouldn't be a choice between randomized controlled trials and observational trials. We need to be doing both. And the opportunity for the United Kingdom and the opportunity for the people we represent, both economically in terms of a highly successful business and improving public health and reducing danger to people from using opiates and the rest, is there for us to grasp. And that's why investors have got it. They understand this. If you can do a presentation, a bunch of people who are going to vote with real money in order to invest in this area, they understand the opportunities that are there. And I urge my old friend, now the policy lead is now in her department and not in the Home Office, that they get the rest of the licensing arrangements off the Home Office and get it into a state where we're going to advance public health, advance the economic interests of the United Kingdom, and make a huge difference to public health in the United Kingdom, make people safer, healthier, and indeed probably, in the end, very much greater value for money than the alternative treatment conditions that people are using at the moment.
Mary Glindon.
Thank you, Madam Deputy Speaker. It's an honour to follow the member from Reigate, who's so impassioned, and it was evident in his speech, and has done so much work on this issue, and I think everyone would pay tribute to what he's done. But I would like to congratulate the honourable member the right honourable member, sorry, for Hemel Hempstead, and my honourable friend, the member for Gower, for securing this debate, and for the work they've done alongside the Feel My Pain campaign to highlight how important and urgent this is. And it's very heartbreaking to hear the stories of families who are trying to access medical cannabis, especially to hear from parents whose children are so poorly, and I think we all would pay tribute to them and for their persistence in standing up for their children.
I thank my honourable friend for giving way, and can I pay tribute to the honourable member for Hemel Epstead, because for a long time now he's been campaigning very strongly. In fact, we met some families who actually brought down to the House of Commons last year, and of course the honourable member for Reigate. But can I say to my honourable friend, if you watched the news over the weekend, she would have seen a family, I think they had to go to Holland to pay over £1,000 to get that medical relief that these kids need, especially medically treated cannabis. Now the question therefore is, why can't we do the same in this country? Why are we being so slow when you look at a lot of these kids suffering, and some of them could actually go into a fit and actually die if we're not very careful here. So I think the government's got to treat this with some urgency. Will you not agree with me on that?
I certainly would agree with you and with an honourable friend, and I think this is a case we're all trying to make here today, because I want to highlight the situation for my constituent who's an adult, and that is Laura Smith, I think, who's known for courageously campaigning for the medical use of cannabis by highlighting the problems she's faced in recent years to access the medicine Bedrocan. Laura's a wife and a mother of 3 children. She was a paediatric nurse herself and also a county fencing coach before her health deteriorated because of cervical and lumbar spondylosis. And she has, over 20 years, had 35 different medications, as well as a number of operations for her condition. Unfortunately, she's been left with permanent nerve damage, limited mobility, and a constant, annoying and debilitating tremor in her right hand. Her quality of life has been completely impaired, not just because of a medical condition, but particularly because of the drugs she's been prescribed over the years. And what it meant was that Laura wasn't able to be the full-time mother she wanted to be to her daughters and son. But fortunately, her pain management consultant in the North East prescribed Laura the drug Bedrocan, and the transformation was such that she was able to come off all her other medications, and her young family did say they felt they had their mum back. But the downside is that Laura can only access the drug by travelling to a Dutch pharmacy to collect it. And her arduous journey was recently shown, I think just last week, on The One Show, and I hope if people haven't seen it, they may be able to see it on Catch Up. She makes this journey every 3 months and has to notify full details of her prescription and her travel details to the border agency. And the cost of the medication and the travel are an expensive cost for her family, but it's a sacrifice they've been making for over 4 years now. And the changes to the law made last November haven't gone any way to making it easier for Laura to get her medication. Recently I raised the issue in a PMQ, and afterwards I received a letter from the Home Office Minister, and he said there should be no barriers to patients getting access to the appropriately prescribed medicine. And he went on to say that the Department of Health and Social Care has been working closely with suppliers, NHS and NHS procurement pharmacists to ensure the prescribed CBPM are available where needed. But this hasn't been the case for Laura and for many other people, as we've heard here tonight. Her private prescription can't be dispensed by NHS patients, and while her consultant has been unsuccessful in obtaining an individual funding request, which Laura is very disappointed about, that was because the hospital trust follow the guidelines of the Royal College of Anaesthetists, which doesn't advocate the use of cannabinoids, citing lack of evidence for the effective pain relief. So all the while, there's no progress yet for Laura. Laura did approach an independent pharmacy to see if they could get her access to the drugs to bring them here for dispensing, but the licence fee would cost thousands, and the cost would have been borne by Laura herself. It's just beyond her reach. The current state of affairs remains frustrating for Laura and all the adults and children who need these drugs. I don't know how many more trips Laura can make to Holland, not just about on a financial basis, but because of her health either. And I'm worried about her. The process the government has put in place is too protracted. And all I can say is I hope the Minister will heed the words of the motion, and particularly the very sensible proposals being put forward today by the APPG. This is a case of urgent need. We can't delay any longer. Please listen, Minister, and please give some positive feedback this evening.
John Howell.
Thank you, Madam Deputy Speaker. Let me start, first of all, by congratulating my right honourable friend from Hemel Hempstead and the honourable lady from Gower for introducing this debate. I think it's very, very timely. And let me also start by picking up something that my honourable friend from Reigate mentioned. All we're talking about here is medicinal cannabis. We're not talking about making cannabis available for general recreational use. I'm sure there are members of this House who would have an opinion on that, and I'm sure that we could have a full debate on that. But we're not talking about that. We're talking only about the use for medicinal purposes. And I think the wording of the motion is very important, because when I read it, it stressed the practicalities of getting the cannabis medicines prescribed. It was not about the generality of about that. We've had that debate on the generality, and the Home Secretary has already reached his decision. This is about the practicality of getting some sort of result for this. Now, I realise this isn't easy for the medical profession, and I also realise that the government has already initiated a review of the barriers to clinically appropriate prescribing. And I think that is a very important review to be undertaken, because I'm going to set out what I think are a couple of the actual barriers that prevent prescribing to take place. And I'm aware too that the National Institute for Health Research is also going to participate in this, which I think is a positive step to be undertaken in this. What we are really waiting for on this are some nice guidelines. And I understand that those are coming, but they need to be brought along pretty quickly. We can't wait forever for these nice guidelines, nor can the children who are suffering. Of course I will give way.
The honourable gentleman for giving way, and I think he's making an absolutely excellent point, an excellent speech, particularly on the practicalities, because for children in my constituency like Cole Thompson, whose mother Lisa Quarrell has been trying to get medicinal cannabis for him for some time, the practicalities are not only is she having to battle what is an absolutely debilitating epileptic illness, which gives multiple seizures each day, and see this deterioration each day in his condition. She's having to battle the medical system, she's having to battle now financial costs, and she's having to battle the government in terms of taking one step forward and two steps back, giving hope then taking it away. And this is too much and too traumatic for any family in this situation to cope with.
The honourable lady for her excellent intervention. And I do agree with so much of what she has said, because one of the main barriers that I see in this is the simple question of who is allowed to prescribe. Who is allowed to prescribe this? There is a list that the General Medical Council holds, a specialist register that the General Medical Council holds of doctors, specialist doctors that are allowed to prescribe. Now, why do we have a specialist list? And why can you only prescribe from that specialist list? Is this because they're nervous about careers? Is it because they're nervous about other things? Why do we limit the number of doctors that can prescribe in this particular way? Now, there is from what I've read, there is a claim that something like 110 patients have been prescribed. But from what has been said in this debate, I understand that only one has actually received the medicine. Of course I'll be quiet.
Honourable friend gives me a great opportunity to the correct hand side. There are two. I've received the message. There are two, both prior to the 1st of November's decision. In other words, the Home Office specialist team set up gave the two, none since the Department of Health took it over.
Thank my right honourable friend for that. I mean, he makes a very valid point. And the question we have to ask is why have there been so few, as he says, only two, that have actually received their medicines, and why has nobody else received them?
Would my honourable friend give way?
Of course I would.
I'm so grateful to his giving way. I've discussed this matter with Helen Stokes Lampard, who is the chairman of the Royal College of General Practitioners. And one of the points that she has made to me is that there just isn't the training available for general practitioners to feel confident enough to make the prescription themselves.
Well, I thank my honourable friend for that, and in fact I'm going to come on to the point of training in just a little while. So if you will just be patient and wait a minute, I will come on to that. But it's a very valid point that he makes. Now I appreciate that we have to go carefully at this stage in view of the harm that unrestricted use of cannabis might have. But the number of people who have actually received their drugs is a mere pinprick on the surface of those that need them. And quite honestly, I'm not surprised that people are going abroad to receive to actually get their drugs, because that's the only source that they can. I fear my right honourable friend wishes to intervene again.
Yes, we've got plenty of time for elections, as Madam Deputy Speaker told me. You can only go abroad if someone's paying for it. You can only go forward if you've got a benefactor, you've got reserves, gran or granddad are paying for it. If you don't have those things and you're relying on the NHS, no point, you don't get it.
I do accept that point, but there are also, I am aware of, particularly when it comes to children who need the cannabis oils, that these are being crowdfunded.
Yes.
And I think that it's a very valuable way of going, but to go into the public arena to crowdfund your drug, it seems to be a complete nonsense for a country that is proud of its NHS. So there is a question that I have around this shortlist that the GMC maintains. And the first question is, how accessible are these doctors? How accessible is it to have a list of doctors that can prescribe this? And the second the second issue around that is, what is the waiting time to see a doctor from that list? All of these things are practical barriers to people being able to get to get the drugs that they need. And let me give an example of a young girl from my own constituency. Her name is not important, but she has intractable epilepsy, and there is a great hope that medicinal cannabis could improve the quality of her life. And many women who suffer the sort of pain and discomfort that she suffers during her menstrual cycle are able to take the birth pill, which eases the pain considerably. However, she cannot, because it reduces the efficacy of her epilepsy medication. And that leads to serious fits, which radically increase. Hannah's epilepsy, her name is Hannah, Hannah's epilepsy is life-threatening. And she is in a high-risk group of epileptic sufferers who could experience sudden unexpected death from epilepsy syndrome. And I think in this situation, we really ought to look at how we can increase the ease with which she can obtain these drugs in order to make her life easier. And I use that as an example because it needs to be brought back to real examples of real constituents to be able to make the points. The second point that I want to make is the point that was raised by my honourable friend in his intervention, and that is in the availability of guidance and in the availability of training. And I do think that both in the availability of the guidance and in the availability of training, we have a great lack of information. And what's more, it's not just us that have that lack of information, so does the medical profession.
Yeah, exactly.
They have that lack of information, and we should do all we can to increase the knowledge and awareness that doctors have, so that we can, amongst other things, broaden out that list, so that GPs and family doctors can have the information to be able to make the decisions that are there. Now, I have no problems at all with this being a clinical decision rather than a political decision. But we have to ensure that clinicians who are willing...
Well, I'm afraid you wait.
Of course I will.
Because on that point, we are only where we are now because a politician faced with the inhuman cruelty of taking the medicine away from 2 children which had been obtained overseas when they returned to the United Kingdom, to take that medicine off them, in the end refused to do so and therefore issued a special licence. And if this is a medicine which is outside the scope of conventional medicine today and conventional assessment of molecular-based medicines, something is going to have to give for us to get the benefit from this.
I do agree with what he's saying, but what I am saying is that we have moved on to a situation where the in-principle decision has been taken, and where the practical decisions... I'm glad it's not me. Where the practical decisions have to be taken by clinicians who are willing and are fully trained to be able to deliver. And if you look at the list of press releases and parliamentary answers, they are full of trying to see where the limit of using cannabis as a medicine is. I saw there was an exchange, I can't remember who it was with, on its use to treat pancreatic cancer. I think that is, from memory, I think the Minister gave a rather mealy-mouthed attitude to response to that thing. But I do think that is something that we need to look at, to extend the limits to others and to other diseases. And I go back to where I started with it, and I congratulate my right honourable friend for bringing this debate. It's not going to rest here. This won't be the last time, I'm sure, that we will have this debate. But I do hope that we will see some real progress in taking this forward.
Tonya Antoniazzi.
Thank you, Madam Deputy Speaker, and I'd like to thank my co-chair on the APPG on medical cannabis under prescription, the Right Honourable Member for Hemel Hempstead, in securing this backbench debate, and the backbench committee for granting the debate on the floor of the House this evening. And it's an honour to follow from the Honourable Member for Henley. I'm committed to campaigning for medical cannabis under prescription, not only for my constituents, but for everyone in the United Kingdom who would benefit from access to whole plant medical cannabis. Whole plant cannabis contains CBD and THC, and it is the interaction of both extracts taken together that provides significant relief from symptoms such as seizures, and this is because it provides the entourage effect. Now, this happens because the 2 extracts interact with the human body and they produce a stronger influence than any one component alone. And we are here today also, and we mustn't remember the number of desperate families that have been passed from pillar to post, blocked at every turn. And is the Minister going to sit back and watch them continue to suffer? Because we have families in the chamber today watching us because they are that desperate and their turn is now. Yes.
I'm grateful to the Honourable Lady for giving way, because she makes a good point here. I first became involved in this campaign in 2002 when I met my constituent, the late Biz Ivel, who had severe and advanced multiple sclerosis, and who told me that the pain she suffered was like having somebody draw barbed wire through her spine. Now, for the last 17 years, we could have been exploring all the issues that are being ventilated tonight, but we haven't. Doesn't that just illustrate why there is now a real element of urgency about this?
I thank the member for his contribution because he's absolutely right, and I'm going to go on to talk about a very, very good friend of mine who suffers currently with MS.
Would the Honourable Lady give way at that point?
I shall.
I'm grateful to the Honourable Lady for giving way, because I have a constituent who is suffering from very advanced MS, and she's been unable to get the medication that she needs, and her husband is growing small amounts of cannabis plants in order that her pain is relieved. Is she aware, and does she recognise that it's not just her that's suffering, but the difficulty with the Staffordshire police? They don't want to act, and yet technically the family is breaking the law. This is an impossible position, is it not? And it really is up to the Department of Health to find out ways in which this can be prescribed more widely and more quickly.
I thank the Honourable Member for his contribution because he is absolutely spot on when we are discussing the issue around the law and people who are using cannabis to relieve their medical pain, especially with the case of people with multiple sclerosis. And the truth is, my very good friend Chris Riley has progressive MS, and this weekend he had to go to hospital. His wife Beth had to call the ambulance, and it took them an hour to be able to give him the correct amount of pain relief to be able to take him in the ambulance to get to hospital. It pains me he's in touch with me all the time, and he is actually the reason why when I was selected as the parliamentary candidate for Gower, he was the first person to contact me and tell me that this was a subject very, very close to his heart and that he wanted me to get involved with. And I thank him for that. But it makes me cry that I cannot help him and I cannot get the medical cannabis to him. And as a politician, I know that I'm standing here and making comments, and I am not a medical expert. But and we all know this, the families, the constituents that we have come to visit us in our surgeries, and the pain and the tears that we share with them because they are unable to access something which quite simply would make their lives a lot better. I shall.
She's been very generous in giving way. I totally agree with what she says. And is it not the case, as cruel as it may seem to say this in the chamber, that when one is suffering from advanced multiple sclerosis, there is going to be only one end to it? And isn't it therefore cruelty in the extreme that anything that can mitigate the pain and the discomfort, which frankly is not going to do any more harm to the patient because there is no cure for this form of advanced multiple sclerosis, is it not cruelty in the extreme that that sort of palliative care can't be administered?
I thank the member for his contribution again, and I do agree with you. It is, and this is where our families with the children with epilepsy, intractable epilepsy, are at that point also, and there are so many people across the United Kingdom in exactly the same position. And my friend Chris is a very good example of how it is wrong that people with MS, with epilepsy, they cannot access the whole plant medical cannabis. It will never be a cure for everyone. We know that. And as he told me yesterday, it's just the chance of a better quality of life. And that is what people want. This is what the parents of the children with intractable epilepsy want. They're at the end of the road. They have done everything from the ketogenic diet to the unlicensed drugs. Drugs which make these children unreceptive and do not improve their quality of life. I will.
Can I pay tribute to my co-chair of the All Parliamentary Group, because without her support we wouldn't be here today as well. And I feel for her constituent, like mine, that they're asking us to help, and we are doing everything we possibly can. But at the end of the day, we're not the medics, we're not the people giving the prescription. But on the point she's just made, doctors seem very happy to sign off and give prescription of off-label drugs for a drug which has got absolutely nothing to do with what it was licensed for, but they're not willing to license medical cannabis. There's some imbalance going on here. Would you not agree?
I agree with the right honourable member, because here we are in a situation that it just doesn't make sense. And it is so infuriating, because I like to apply sense and logic to most situations, and at the moment we're not in a logical position. And not being able to access medical cannabis does make people like Chris and the parents of children with epilepsy look at alternative ways to accessing cannabis, as we've already spoken about, fueling a dangerous online trade where they could be buying anything, and we don't know if they are. And this is dangerous and wrong. Clinicians I have spoken to often ask the parents and their patients, what else have they given their children in addition to the over-the-counter drugs that they have had? And the access to CBD alone has great health benefits which are not recognised by many in the medical profession, as the Honourable Member for Hempstead has already said about it being called homeopathy. We know that the attitude, when I say that one of my interests lies in medical cannabis, there will always be someone, even politicians, that will make the pun about wacky-backy, and it's really not appropriate. So there seems to be a theoretical concern about the exposure of children to THC. Now, this is the exposure to recreational users. This is not about medical cannabis. The discussion around the legalisation of cannabis for recreational use and the rescheduling of cannabis for medical use under prescription must not be conflated in this House. So let's put it into perspective. The law changed as a result of one boy, Alfie Dingley, the campaign spearheaded by his mum, the fantastic Hannah Deacon, that is in the gallery today. Now, Alfie's... And Billy Caldwell, yes. And Alfie's life has been transformed. He has gone as long as 300 days being seizure-free, riding a bike and riding a horse. Hannah continues to campaign for the parents who cannot get access to medicinal cannabis for their children, because their children need the same treatment for their intractable epilepsy. And the reality is the law has changed, but access to medical cannabis is even more stringent as a result. Under the guidance provided by the BPNA, would Alfie now be eligible for his prescription? That situation absolutely beggars belief. And the government were aware that they were opening the floodgates by providing the access to Alfie, but the pushback from certain areas of the medical profession is what is stopping the advancement now. We've seen it with a number of patients, and it is extremely unfair. The supply of medical cannabis that is used in these prescriptions is GMP standard. It is accepted in Europe. It's reached the standards. Now, the fact is, we're in a situation that these drugs are going to have to go through trials that could take 3 to 4 years. That is not acceptable. It is not acceptable for the parents of the families that we work with at End Our Pain. It's not acceptable for the parents of Bailey Williams, who are in the gallery today, because they can't wait any longer. They did use a CBD drug, and I think they still are, but it's not working. It's worn off. That's why they need the THC. These products are available, and they need to be made available now, because this current situation is a two-tier system. We've got those that can go and get it and have access to it because they have the funding, and those that can't because it's not available on the NHS. And we have to change that. Yes.
For her giving way and pay tribute to the work that she's doing on this. But it's worse than that. we are driving a number of people into the hands of the criminal supply chain in order to get their medicine. And that can't be right.
Thank you for the intervention. And yes, I totally agree with you, and that is something that I am very, very concerned about, because we've heard on the floor of the House this evening that people are growing their own to be able to access cannabis. And there is a growing trade. There is an online family of people that are supporting each other about how to get the most THC out of different combinations of different plants. It is a complete industry. And why is the government not taking a grip of this and actually providing the proper GMP, pharmaceutical product for our, yeah. So one of the things I also wanted to talk about was the cost, and the cost is extraordinary, but how much has somebody actually done? Has the Minister or has anybody in her office actually done a cost analysis of, for example, Alfie Dingley would be a classic example, about how much he has saved the NHS by not having the emergency medication and going into hospital, with the ambulance service. How much has that actually saved the NHS? It just seems nonsensical that we are not going down this road. So, I wanted to talk again about a couple of my constituents, because only a few weeks ago I had a visit from parents of a 14-year-old son, and my son is 14, and this really struck a chord with me, because he has intractable epilepsy, and mum has given up her job to look after her son, and has a very, very efficient system around him. And he benefits from a ketogenic diet, and the next available medicine is the Epidiolex. We know that the Epidiolex does not contain the THC, but she wants to have her child on a trial, and the trial is limited. Now, that shouldn't be a situation where a mum comes to me begging to be on a trial. But when I spoke to her about medical cannabis with THC, there was a real reluctance to engage in a conversation around that because of a fear of breaking the law, because of a fear of not following a system properly. Now, all our families are following a system. They are at the end of the road of what medicine they can be given. So I want to see them being given the medical cannabis with the THC as soon as we can. Now, NHS England are drafting terms of reference, and as the co-chair of the APPG, I appreciate their efforts. But these children, however, must have access. They can't be waiting 3 or 4 years. And I urge NHS England to work collaboratively with the devolved nations, because we need our children in Scotland, in Wales and in Northern Ireland also to have the same benefits as well. I will.
I congratulate her on her excellent speech and the excellent work that she's been doing with the APPG, and also want to congratulate the End Our Pain campaign that have done so much to raise this issue. Will she agree with me that in relation to intractable epilepsy, the NHS England need to improve their guidance and actually fast-track it so that the children can get the THC that they need?
I thank my honourable friend for his contribution, and yes, I totally agree that this needs a completely different approach if we are going to get the medicine to our families now. So it's really upsetting when you also see that these families are risking criminal records by going to get by bringing the medical cannabis back in, and also having to fundraise for the prescriptions. And again, I'd like to pay tribute to those families that are fundraising in the public domain, to the parents and the friends, to Craig, who's cycled many, many miles up Pen y Fan very recently to raise money for Bailey. But all those families that are raising money, don't give up. There is hope, and hopefully we will be able to get you the medicine you need on prescription with the NHS. It would be very remiss of me not to stand here and pay tribute to the late Paul Flynn, the former member for Newport West. Yeah. Paul was an absolute inspiration. I'm a patron of an organisation with him, and he was absolutely inspirational when I went to Birmingham to speak with him. His knowledge and his passion for medical cannabis was second to none, and I know, as has already been mentioned by Madam Deputy Speaker, that he is watching over us now, and he is hoping that we will get the breakthrough that he was so working towards. But I want to conclude. My honourable friend from Withington has spoken about a bespoke medical response. He's spoken about creative thinking. And I would like the Minister to work with us, pull out groups of families out of local trusts and set up an immediate observational trial with the 18 families that we have at End Our Pain. Get the NHS to pay for the costs of the medicine when a private prescription has been issued until NHS prescribing is more routinely accepted. And allow the guidance from medical cannabis experts to be used. There are some excellent UK experts that have come together and formed the UK Medical Cannabis Clinicians Society, and they have issued prescribing guidance too. But please work together with the NHS to give clear central guidance that medical cannabis is legal and that there is an expectation it will be prescribed as a normal, unlicensed medicine when appropriate. Thank you, Madam Deputy Speaker.
Charlie Elphick.
Thank you, Madam Deputy Speaker. It's a pleasure to follow the Honourable Lady, the member for Gower, who spoke so movingly and with such great sincerity on this important subject. And I'd like to congratulate her and my right honourable friend, the member for Hemel Hempstead, who have secured this debate this evening. A debate which is incredibly important to my constituents in my constituency. I have the case of Tegan Appleby. Tegan is just 9 years old. She lives in Aylsham. She is wheelchair bound and she can suffer up to 300 seizures a day. She's born with a rare condition, isodicentric 15, a severe form of epilepsy. Last year, she required life-saving treatment 5 times in just 8 days. And Tegan's mum, Emma, is in the gallery this evening, has been a tireless fighter, not just for little Tegan, but for the medicine that little Tegan needs. She's tried everything to ease Tegan's pain. One thing she couldn't try was cannabis oil, despite the NHS trials showing that it could dramatically reduce epileptic seizures. The alternative suggested by doctors was that Tegan of having risky procedures on her brain. Now, understandably, as any parent, Emma doesn't want the surgeons getting out the scalpel and starting operating on her daughter when there are alternatives available. And that's why last year I urged the Home Secretary to intervene in Tegan's case, along with so many others, including my right honourable friend who fought on this, and I welcome that he did so. Last October he announced that cannabis would be medically prescribed by specialist consultants, yet the reality was somewhat different. Tegan's treatment was still delayed. Firstly, due to the restrictive guidelines drawn up by the NHS, and then due to supply issues. And you know, I visited Emma and Tegan at their home in Aylsham. It's incredible, isn't it? All of us who are parents fight for our kids. And yet somehow when you see someone in Emma's situation looking after little Tegan, you just can't help but think some people fight harder than others. And no one could fight harder than Emma does for Tegan. Tegan is so charming. And it seems to me that things have definitely improved, but Tegan was still suffering seizures during her sleep. And Emma started fighting to get the stronger THC form of cannabis that we've had discussed this evening, fought to get that approved, to see if it could put a stop to the seizures altogether. So she went to mainland Europe to get it, because she couldn't get it here, went to mainland Europe to get it, and it was seized on her return. Now, the latest position is that Tegan is getting better. She now goes some whole days without seizures, which was extremely rare before. She can now walk short distances. Her doctor is so pleased that he's issued a fresh prescription. Yet she still can't get it on the NHS. The fact it's legal but unlicensed means that Emma has to submit an individual funding request to the local clinical commissioning group. It takes weeks for these panels to meet and weeks to make a decision. That's why, in the meantime, Emma has to fork out thousands of pounds of bottles of cannabis oil. The price almost doubles when you add in the import duties. That is, of course, when you then don't have the extra hassle of having it seized at the border. And that's why Emma is having to consider going to Holland again to get this much-needed medicine for little Tegan. And I ask the House this: should she not be supported and helped? Should she not be understood as having the compassion that every parent has for their child? And is it not wrong that she is effectively declared by the law as though she is acting as some kind of drugs mule? How can that be right? And I don't think it can be right. And I think there has to be change. Now, I think all of us understand the issue, that there needs to be evidence. All of us understand that there need to be clinical trials. All of us understand that there needs to be proper processes. But none of us can understand why it should take so long. And none of us can understand why it is that we are so bad at dealing with pain management in this country. I just don't think we're good enough at all. I give way.
I thank the member for giving way, and he's making a very important and powerful speech. And on that point, I mean, is he not as frustrated as I think all of us here, and the families particularly, just how long it's taking for this to go through, to be legalised, and for GPs to be allowed to prescribe it? When you have products like oxycodone and OxyContin and other opioids, which are totally addictive yet available at great cost, surely the time is now to get this allowed and make it legitimate.
The Honourable Gentleman makes absolutely a powerful point, and one with which I wholly agree. And it's not just about speed, but it's also about consistency. You know, you can go to your local supermarket and you can get ibuprofen. And they say it's all safe and you can buy as much as you like, but you have to go and get a prescription for naproxen, which is a similar sort of drug, because it's meant to be more dangerous. That's despite the fact that in 2016, in an article in the British Medical Journal, the experiments and evidence concluded that the risk of heart problems is higher if you take ibuprofen than you do naproxen, and that naproxen is less problematic and has less side effects than ibuprofen. Yet nothing has happened about it. I give way.
I thank my honourable friend for giving way. He's making a very strong point about consistency. In this policy area, we have a reserved area about the legalisation or decriminalisation of drugs policy, meeting a lot of devolved areas, which is delivery of health and social care. Does he agree with me that actually we should have consistent training and delivery programmes across the United Kingdom, so it doesn't matter where you are, whether you're in England, Scotland, Wales or Northern Ireland, you make sure you get the same standard and access to help you and your family?
I completely agree with my honourable friend, and the whole House knows that he is a true champion of his constituency and a true champion of the union in which we live, and the importance of having consistency so that anyone can go and practice, whether they are England, Wales, Northern Ireland or Scotland, I think is really, really important. And I think he makes an important point, the need and importance of ensuring that level of consistency. And that is why I also think it's important to have consistency in the NHS in making sure that drugs, when there is evidence available, that they take action and they look at the issue, say, of naproxen and ibuprofen, rather than just carrying on regardless. If they say that evidence is important, they should be doing something about that. And indeed in America, naproxen isn't on a prescription at all. You can just go and get it in your local drugstore. And in the same way, they won't prescribe cannabis oil, or make it easy to prescribe cannabis oil, but it's easy to get codeine. And if you've got a bit more pain, it's easy to get tramadol. If you've got a bit more pain, then there is morphine as well. We have opiates which are very legal and very easy to get a prescription for, and yet somehow we have some kind of mental barrier about cannabis and cannabis oil. And so that's what I would say, is it's really important that we understand the importance of pain management. We treat pain management more seriously for all conditions. We look at what can be done to ease pain at all people, with all conditions, and that we act swiftly, consistently, with the evidence, but also without delay. And that's why I think it's right that we should act to end our pain, act to help people like Tegan and the many other constituents that each and every one of us have who suffer, to end that suffering, end that pain, and to make it easier to them to get the medicines that they need to make a difference to their lives.
Patrick Grady.
Madam Deputy Speaker, I congratulate the member for Hemel Hempstead and Gower on securing the debate, and the Backbench Business Committee for managing to schedule this at a time that really has allowed, I think, for a very reflective and open and actually quite consensual debate, and I'm really looking forward to what so far, and I'm really looking forward to hearing what the ministers have to say in response, because it does seem to me that we're debating an issue whose time has come. The individual cases have come together into a campaign that really shows where I do believe a consensus is beginning to lie. So I want to reflect just a little bit on that, speak like many others have done on an individual constituency case, and think a little bit more about the consequences of the wider campaign. And some of the members at the beginning for Hemel Hempstead and Reigate and elsewhere spoke about the growth of this campaign and the public awareness of the issue, and how often I think some campaigns like this can start with what seem like very isolated cases. One individual comes to one of our surgeries, and a member has the incentive to raise it here in the House, and then others join in and say, but I've had that as well, well, I've had that as well. And then we get the urgent questions and we get the backbench debates, and it becomes a much liver and more mainstream issue, and members of the public are encouraged to come forward to their MPs with their individual cases, and the broader public is encouraged to come forward in support of the overall issues. And we've seen that on a number. I think of the WASPy campaign, quite weirdly, it's a completely different kind of situation, but the way of that sort of snowball effect of an issue as people come forward to their individual members with their local cases, and it builds into a positive campaign. And that's why I think the policy environment now really is ripe for change, and we've heard already in the speeches today of the knowledge and experience in other countries of how these different kinds of cannabis-based medicines have been rolled out effectively. And in fact, we've heard about it here as well, because there are people, if they can afford private prescriptions, they are feeling the benefit. But of course, that means it's incredibly frustrating for those who, for whatever reason, can't access the medicine privately, or the right kinds of medicines privately. And the whole point of the NHS is that treatment should be available free at the point of need, and blind to people's individual financial circumstances. And that's why the progress that has been made from the government has, to a certain extent, been welcome. But in fact, the hope that was provided when the reclassifications were announced and the provision for prescriptions from individual doctors was announced, that hope has nevertheless been dashed, as the regime has been proven or turned out to be quite so prescriptive. Yes.
In the cross-party consensus we have, this is not a dig. I say that at the start, so there we go. This is devolved in Scotland and in Wales and in Northern Ireland. We have had prescriptions privately in Northern Ireland, and there was progress in Northern Ireland from Scotland could do this. We could do this. Wales could do this, and I know there are discussions going on within the department, but we mustn't take this in isolation, I don't think. This must happen across the United Kingdom. I agree with devolution, passionately agree with devolution, but no child should suffer because one area has devolved and they're playing catch up to the other parts of the United Kingdom.
Yes. I think that's fair enough, and I want to maintain the tone of consensus. Licensing and classification of drugs remains a reserved issue, and you're right. The governments have to work together. They have to move forward together, and I think the Scottish Government has indicated its willingness to do this. But we have to make sure, I think, as you say, that we move on. And frankly, in Scotland, we're always happy to take on more responsibilities. We're always happy to take on further devolution. And if we can't see the progress that's being looked for, then maybe that's what we should do. So I do want to speak a little bit more about a specific constituency case that I've raised once or twice previously in the Chamber. My constituents Laura Murray and John Ahern came to see me in November 1st for the first time in 2017, a few months after their beautiful daughter Blathnaid was born. And she's been diagnosed with Aicardi syndrome, which affects only around 4,000 cases are known worldwide, so it is an incredibly rare syndrome, but it has the same kind of symptoms as others have described: frequent seizures, the possibility of visual impairment, and the traditional the treatment for it is very limited, and the medicines that have been prescribed are incredibly powerful and have their own very debilitating side effects. And I think the member for Gower made the point extremely powerfully: is how much money has the NHS been spending? And I appreciate some of this is devolved. How much money has the NHS been spending on providing emergency treatment and last-minute access and very expensive specific drugs when the parents are so keen to see another alternative tried? And they have written to myself and indeed to the Health Secretary describing the situation. They said, quote, "She suffers multiple seizures every day and night, which causes her extreme distress. They cause her to scream in pain, cry tears, and become highly distressed, which is distressing for her and for us as parents and for her family to witness. She's been hospitalised due to the severity of her seizures, and whenever she is ill, her seizures increase and she ends up in hospital. This is no way for Blathnaid to continually suffer and to have no quality of life." And we hear, sadly, too many of these situations. And so they are looking for access to full extract medical cannabis and are otherwise at their wits' end. And I think it's been particularly galling because, of course, as a wee girl gets older and becomes more aware of happening, it becomes even more frustrating and even more painful. So I have written to the Health Secretary and the Home Secretary and the Health Secretary in the Scottish Government, and I want to work with every single possible level. I will meet with ministers, I will meet with the GMC, I will meet with the local health board, whoever I have to try to make progress for this one individual case. But it shouldn't have to come to that. I mean, almost every single member that's spoken, I think, has raised a constituency case or an individual case that they know about, and that has to be a demonstration that the overall regime and the overall framework has to change. And this point particularly about doctors having to take personal responsibility, I think, is a hurdle that a number of individual cases are running up against. And I know there was provision for second opinion, certainly on this side of the border that we're currently at, and I want to find out how that is or can work in Scotland. But I do hope that it shouldn't have to in the future come down to these individual interventions, that we can have a more permissive atmosphere. And I would just reflect as well, and I appreciate the devolved and reserved matters, but I was a little bit disappointed simply to be batted to the Scottish Government by the Correspondence Unit after raising the issue here on the floor of the House and after including this very personal testimony from my constituents. And I hope we can maybe have a little bit further engagement with the Government Department down here as well. I think it's interesting that the campaign is called, the broader campaign has been called End Our Pain, because it does go beyond any one individual case. We're seeing dozens of constituents of mine have just been in touch generally in support of this campaign because they see the benefit to themselves and their families, to their friends. They see the benefit to wider society, and they've been moved by the different stories that have been heard across the chamber today and throughout the campaign. And I think when they call it End Our Pain, it's not just the physical pain, it's not just the physical symptoms that any one individual is experiencing. I think it's the pain of the frustration, the pain of the delays, the pain of the uncertainty, the pain of knowing that others are suffering and suffering unnecessarily, the pain of knowing that a solution is out there if only they could get their hands on it. So I think, as I said at the start, this is an idea whose time has come. The public support is there, the evidence from other countries is there, the individual evidence when people have been able to access this in the United Kingdom is there as well. And as I say, the Scottish Government stands ready to do its part, and I hope the United Kingdom Government will take this opportunity to act as well.
Yeah.
James Cartledge.
Thank you, Madam Deputy Speaker. And it is a pleasure to follow the Honourable Gentleman for Glasgow North, a very good speech, and always a pleasure to see someone fighting hard for his constituents, like we all are. And he's right about all of us mentioning these cases. I will be doing so. Before I do so, I just wanted to pay tribute, as others have done, to my right honourable friend, Member for Hemel Hempstead, and the Honourable Lady for the Gower, for the great passion and tenacity with which they have campaigned on behalf of those who are suffering such pain and looking for a way to reduce that pain, and believe they have found a way. And that is obviously the key challenge for us. My case, it concerns a girl called Indy Rose. She's 4 years old. Her parents, Anthony Clary and Tanny Montgomery, live in Clare in my constituency. She has Dravet syndrome, and as we've heard in other cases, suffers those terrible, very frequent seizures as a result of her epilepsy, but has found that by taking cannabis-based medicine, that those seizures have been reduced dramatically. They estimate by around 75%, but at a huge cost, because my constituents, as in other cases, have had to go out to Holland, having crowd-sourced thousands of pounds to pay for medicine from the Netherlands and bring it back to this country. And so I feel very strongly that we do have to look at this issue, because, as others have said, that cannot be sustainable, especially in a country which has a free healthcare system available precisely to help those, not just those in need, but particularly those most vulnerable and in the greatest need. The medicines that they have been purchasing, or the compounds, the artisanal, you might say, unlicensed, is a mixture of Bedica and Bedrolite, which of course contains THC. And for me, what I have found to be the greatest single issue here is that whilst there is evidence around the impact of CBD, evidence that is based in this country, there is very little around THC. Now, when I first became involved in the case, I felt that I had a duty to understand it more, understand why there was resistance in, we might call loosely, the medical establishment to prescribing a THC-based solution, such as that which was already being given to Indy Rose, and in the opinion of her parents, very successfully in reducing her pain and suffering. And so I organised a meeting in April at Adam Brooks Hospital with some of the most senior clinicians who you could hope to have in the room, all familiar with Indy Rose's case, to discuss the case with them, because we are lucky to have in this House honourable members who have very serious medical experience, but most of us are not clinicians, and none of us are the clinicians in the cases that we're talking about. We are politicians. So I wanted to understand better the barriers to the prescribing that my constituents were seeking on the NHS. And as I say, I think the key thing, in this debate, sometimes it's been spoken of as if it's about whether cannabis-based medicine should be prescribed. It is clearly about the type of medicines that should be prescribed. Because I just finished, and then I'll give happily to my old friend. There is clearly nervousness in the medical establishment about THC. I don't think there's, we shouldn't hide that point, and there's perhaps very good reason from their point of view. I'll give way to my honourable friend.
I thank my honourable friend, but would he not agree with me that his own position just is further evidence for why we should have the conclusions of the interim report of the NHS review on this, which was requested by the Secretary of State, I think it should be published as soon as possible to help us identify answers to the points that my honourable friend has rightly made, so that constituents such as my own Evelina Lukasovius, who's 2 years old, and Maya Fairley, who's 7 years old, might be able to access this life-saving medicine, if indeed that's what the review concludes.
Well, it's a very good point, and I'd just be cautious on the phrase life-saving, because of course this is about easing pain. These are not cures, relieving the pain of seizures. But I think he meant, I understand exactly the point he made, I think we all did. But just returning to that meeting, it was very instructive for me in many ways. And since then, I've obviously carried on corresponding with my constituents, trying to explain to them the powers that I have in this case and the next steps that they need to go through. And when this debate came up, they emailed me and asked me particularly to put one question to the Minister, which is, these are constituents, remember, who are not being prescribed THC-based compounds. They have been offered Epidiolex, which is CBD-based medicine. And they wanted me to ask, have any other children with epilepsy or any other condition, but of course it's primarily complex epilepsy, have they been prescribed THC-based medicines? And actually, the information is in the public domain in a form of written answer. And as I understand it, there have been 110 items prescribed. So it's not people, but items prescribed with CBD-based medicine, and 16 cases where 16 items have been prescribed with THC included in the compound. 6 of those on the NHS. Very important point. And that was the question my constituents wanted to ask, because they wanted to know, have others been granted that? So clearly they have. And I think, let me just finish the point, then I'll happily give way to my right friend. The confusion for me is, where is the consistency? Now, of course, we cannot know each other's, in each case, the personal, unique medical facts. That must always be down to the clinicians. But we now know THC-based solutions have been prescribed. I'll give way to my right honourable friend.
And I thank my friend for giving way, and I think it's fantastic that we've got the time to talk these things through, because we don't have one NHS. As in, where his commentary is there is that some have. My own constituent has been refused CBT, completely refused, and the letter came back saying, no, Mr. Penny, we don't get in homeopathic medicines. More of a fear for those people that do use CBD is whether or not the European Commission are looking at banning CBD purchases, not on prescription, but where it is bought in the public area. Now, they see it as a novelty food, apparently. And that's an area where we need to move on to, because a lot of our constituents use products which are perfectly legal to ease their pain, which have not got THC in them, of course. But in my own constituent's case, and she's literally just texted me to say thank you, because the medical company has given her some more oil because the CCG have refused, and thus her GP cannot write the prescription.
Well, I thank my right honourable friend. I'm sure his constituent would be very pleased to have seen that intervention. Actually, he, in a way, he underlines the key challenge, which is that these medicines we're referring to are what's known as artisanal. They are unlicensed. They are not standardised pharmaceutical delivered medicines, and actually which can be a problem for doctors who want to know, what will be the standard makeup of percentages of these chemicals contained. They don't know, they feel they cannot entirely rely on them. And I think this is where the nub of this is, to what extent we in this place should be applying pressure on those who have to make clinical decisions. And my honourable friend, the member for Reigate, made a brilliant point earlier, because my honourable friend for Henley was speaking and he said this has to be a clinical decision. But as my honourable friend for Reigate quite rightly said, if it wasn't for us, we wouldn't be here. And we wouldn't have been prescribing what's been prescribed so far. Let's be honest about that. It's been a result of campaigning, which is why I congratulate all those who have campaigned. Nevertheless, and this is why we need to understand the balance here, nevertheless, ultimately, this has to be clinically based. So it seems to me we cannot have political prescribing. We cannot have a situation where, let's be honest, it may be the case that the maximum pressure applied may have resulted in some prescription decisions. I hope that isn't the case, and it cannot be the case, but in reality it may have been the case. What we need, I'll give way to my other friend in a minute, what we must have is a consistent, transparent system that we have faith in that will lead to clinical decisions delivering the best outcomes for our constituents. I'll give way.
And that's exactly why the review into the blockages of where the prescriptions have been signed and then not done, which is being done by NHS England at the moment. And I understand the Minister probably will come and confirm this, but there's an interim report coming from them by the end of this month, and I believe the full report will go to the Secretary of State by mid-June, which is very quick for the NHS to work on. But it has to be an understandable level playing field. It's not for us to tell the doctors, but if a doctor is prescribing it, who is suitably qualified, what is the blockage then is what we need to know for his constituent and for the rest of them.
Exactly, and I thank my brother, and that's what I've been trying to understand. I think if I were to hazard a sort of a guess, I think there has been an institutional resistance, particularly to CBDs in general, but particularly to THC, and that in a sense we have helped force an opening, an open-mindedness towards it, because let's be clear, when people say there's no evidence, what we mean is there's no evidence from standard clinical tests. The idea that there's no evidence is not true, because the evidence is our constituents' lives, what they're seeing every day. My constituents don't go to Holland having crowdfunded all that money to buy something because it's not working. You know, they are parents. We do have to have faith in them, and all doctors, by the way, do put a lot of stall in that. But nevertheless, for the institutions that issue the guidance, that ultimately lay the foundations for medical decisions, as it were, in addition to individual circumstances, they have to ultimately have, in the long term, for it to be sustainable, that clinical trials evidence. So my appeal to the Minister, and I welcome her to her position, she's very much deserved that, is that we do put everything we possibly can into getting that empirical evidence, to getting those trials undertaken, so that we can really say to our constituents that everything is being done to ensure that the clinicians can make those decisions with the greatest confidence without the nervousness that I think we have all encountered. Because I want to make a final point here, which I do think needs to be said. In the meeting I had, it was said to me, you do realise we're being trolled. Now, these are members of the medical profession. We as politicians have had debates in this chamber about the horrible abuse we get, the horrible abuse, and some have had abuse that is obscene, particularly female colleagues. But members of the medical profession are now getting the same thing. And I understand the frustration of a parent who has done everything they can to support their child and feels that the system isn't helping them. That's why we're here, that's why we're doing this. We want them to be supported by the system. But there can be no justification for people in the medical profession being subjected to trolling and the sort of abuse that I know they have had, because they feel they have to make an objective decision, because they have the best interest of the patient at heart. I have faith in the medical profession, but they are nervous because of the lack of evidence. So I think we need to move on with those trials as quickly as possible, and we need to be able to give our constituents confidence that the system is fair and transparent and is consistent and is not acting in an ad hoc fashion.
Stephen Twigg.
Thank you, Madam Deputy Speaker, and it's a pleasure to follow the Honourable Gentleman, the member for South Suffolk. I think he made a powerful and reflective speech, and in particular, if I can endorse what he said about how important it is that we have that evidence, but that a lot of that evidence comes from the families themselves. Can I join in congratulating the Right Honourable Gentleman from Hemel Hempstead and my honourable friend from Gower, the co-chairs of the All-Party Parliamentary Group, both for securing this important debate today, but also for the leadership role that they've played on a cross-party basis on putting this very important question on the agenda of the House. As many have said, hopes were raised last year when the Home Office did what they did, and I want to very strongly support today what my honourable friend from Withington said about the importance of achieving a bespoke solution for our country, and in particular what he said about learning from international evidence, because I think that combination of points of listening to the families and the campaigners and learning from the evidence from other countries could assist us in achieving the urgency that I think all of us in this debate want to see. Of course, I'm delighted to give way.
I'm waiting to return us. But this bespoke argument is something that we have to address here. Every other country that has done this has done it in a bespoke way. Now, the fear is if you introduce a bespoke system for a product, a drug, everybody else will jump on the bandwagon and they will all want a bespoke. Most countries in Europe address this. It has to be bespoke, not least because it was illegal as a Class A drug in this country, a Schedule A drug, sorry, for so long. But the evidence is here in the mums and dads and the children.
Absolutely. I endorse everything the Right Honourable Gentleman said, and his point about the evidence being here brings me to the main subject of my speech in this debate this evening, which is to speak on behalf of my constituent, Nathaniel Leahy, and in particular his parents, Lauren and James, and his mum, Lauren, is here in the gallery today. When Nathaniel was 3 months old, he had his first seizure, and he was diagnosed with a rare genetic disorder that resulted in him experiencing up to 100 epileptic seizures every day. In fact, his mum and dad were told by the doctors that his condition was so rare that as far as they could see, it was the only case of that condition anywhere in the world. Eventually, he was prescribed via the NHS Epidiolex. And what his mum Lauren has said to me is that initially Epidiolex did bring some positive effects, but these were not sustained. In a sense, they plateaued in her words. And so she looked for something that would do more to ease the incredible pain that her son was facing. And she was unable, via the National Health Service, to secure a prescription. So she went to the Portland Hospital here in London, and the specialist there, who was previously at Great Ormond Street, gave a private prescription for Bedrolite, and that is the prescription that Nathaniel is now benefiting from, making a difference to the quality of his life. The cost to the family of that private prescription is £2,200 per month. £2,200 a month. They are fundraising, they are crowdsourcing funds in order to be able to get that treatment for their son. That surely, Madam Deputy Speaker, cannot be right. We've heard from a number of speakers on both sides of the House about the principles of our National Health Service, about meeting need and not having to contribute in that way financially, and that extraordinary figure of £2,200 every month. That is why I was keen to make a brief contribution in today's debate. We need to move forward. Yes, we need absolutely to move forward based on the best available evidence, but part of that evidence, surely, is the voices of the families and making sure that their voices are heard in this debate. Nathaniel recently celebrated his first birthday, and his mum, I hope she doesn't mind me saying, his mum said to me earlier that it was a first birthday they were never sure he was going to see, and they're very proud that he got to celebrate his first birthday. I hope that when she closes the debate, the Minister can offer us some hope, but perhaps more importantly, a sense of urgency that I can take back to my constituents, but in particular, that I can take back to Nathaniel and his family.
Andy MacDonald.
Thank you very much, Madam Deputy Speaker, and thank you for the opportunity to address the House on this very, very important debate. I want to restrict my remarks to the subject matter of medical cannabis under prescription, and particularly in respect of epilepsy. There have been comments made about the wider application of cannabis, and that's not what we're talking about here today in terms of recreational and casual use. This is the most serious medical issue. And I do want to congratulate the Right Honourable Member for Hemel Hempstead and my honourable friend from the Gower for securing this debate. It's a matter of critical importance. And may I also pay tribute to our very good friend Paul Flynn for the work that he has done in this area. I had the great honour to accompany him as the leader of the opposition, extended the octogenarian's career development plan by appointing him as our shadow leader of the House, and many a chuckle we had on a Thursday morning, and we were the better for it. I also want to pay tribute to Professor Mike Barnes, and it's funny how our paths have been intertwined. As a lawyer representing the victims and the families of serious injuries, in particular brain injuries, Professor Mike Barnes was a terrific font of knowledge and expertise, and it comes as no surprise to me that he's decided to devote his entire career to this critical issue now, and no finer advocate or expert could we have in this cause. But I also want to particularly pay tribute to the parents of children suffering from epilepsy, and I know Hannah is here, and I also pay tribute to her and to Charlotte for the work that they've done over the years. And may I also, Madam Deputy Speaker, pay tribute to my wife, Sally. I've got to put that right because I never actually said so in my maiden speech, so she'll be pleased to realise that I'm putting that right. But as the parents of two boys with intractable epilepsy, we had the most incredible journey, and I am so grateful to her for everything that she did for our children over the years. It was enormously difficult. The seizures came with such regularity and such force, and we had to become experts in the area. And I'll say some more about parents a little later, but when you have to understand the condition and the science of the drugs behind them, it is a huge demand of parents. And for our part, we had to suddenly become not only expert in the condition, but also expert dietitians as we try to embrace the ketogenic diet, which is those parents who've ever tried to deploy that as a way of dealing with the issue know just how difficult it is. It's basically a high-fat diet, and trying to starve your children in the first instance to put them in a state of ketosis is incredibly difficult when you've got your little ones screaming at you that they're starving hungry. And it's quite curious that this was basically a technique that was used in the Middle Ages. If somebody was having a seizure, they were deemed to be possessed of the devil, and they were thrown into a cell where they were starved. And the ketones would work, and people would come back to the individual concerned to find the devil has gone, the seizure is over. And some of the pain that people are suffering to this day, I think that's equally as barbaric in terms of some of the stories we're hearing about parents who haven't had access to these treatments. And the Honourable Gentleman from South Suffolk did make a point about this not being an issue. I don't want to misquote him, but I just want to take this point about it can be an issue of not just pain relief, but it can be the difference between life and death. And we know that from our own case, because I lost our son on the 4th of February 2006, having entered into status. And I look around, and I am absolutely determined that no parent would have to run that risk, not having had the opportunity to explore this as a possible way of dealing with their child's epilepsy. So there's been some terrific contributions here today, and I do pay tribute to all of the speakers because they spoke with such intelligence and such expertise. There's a real common purpose here to get this right, and I know that that's the case. And this is this House of Commons at its absolute best, and I congratulate each and every one of those speakers who's made those contributions. We've had a very intelligent conversation about CBD and THC, but I would just point to those other jurisdictions that have satisfied themselves that this is efficacious and it is a legitimate way of treating this intractable condition. And not only that, we don't need to look to those other jurisdictions. If we just look at the parents who are having to go to such extraordinary lengths to deliver the very treatment that they know works for their child. So if it's acceptable across Europe and in the Netherlands in particular, and in Canada and in New York, all I would say is that the evidence base is there. The evidence base is in other jurisdictions, and it's with the benefits derived by the children we know about all too well. And I do take the point that was so eloquently made by the member for South Suffolk. Our wonderful clinicians have only one thought in mind. The only thing that concerns them is to bring about the improvement in the condition for that child and to alleviate those symptoms. And I think he makes a very valid point. Any clinician who has been put under that sort of pressure that he describes has not only our sympathy, but the people who do it need to really have a look at themselves in the mirror. That is not how we go about such a difficult issue. But I would say to those clinicians that if we do need to address issues of training and expertise, let's get on with that. I suspect, and I've heard it from others, that some of those clinicians may be feeling somewhat inhibited and unable to respond in the way that they would wish. And if it is a matter of sufficient knowledge and training, that should be addressed. It may be that they are suffering under the misapprehension that they have a reluctance to act because of the spectre of clinical negligence claims. And I would just say to them, and as I say to all medics, please put that consideration to the back of your mind. Any practitioner relying upon evidence will not be criticised. If no reasonable practitioner would have done that thing in prescribing that way forward, then there's an issue before us. But if that's within the bounds of competence, of reasonable skill, and there's a body of knowledge that would allow a practitioner to do that, they can really dismiss those thoughts from their mind. And I too, as my friend from Liverpool West Derby said in his contribution, that we've very much welcomed the change in tone and approach of the government not many months ago. And the government was rightly applauded for that. The tragedy is that it hasn't been acted upon ever since, and there are thousands of families across these islands who are crying out to be given the facility that was afforded by that change. It hasn't happened, and we're in grave difficulties. But I'll finish, Madam Deputy Speaker, basically where I started. And if we can look to those parents who understand the condition and understand what works, listen to those parents. They are expert, and I would encourage the clinicians to listen to their detailed examination and the expertise that they have built up. We simply cannot tolerate a situation where hard-working mums and dads are having to go into hock to pay for these medications. It is an utter scandal. We hear at the APPG of couples who are paying £1,500, £2,000, £2,500 per month. I have no idea how they're carrying this burden. They have enough on their shoulders. And there is a solution. We know that works, and they should be given that opportunity to bring some stability to their child's condition and some solace and peace to their own lives whilst they're at it. They have their expertise. We should listen to them and do the right thing by them. The evidence is there. We should embrace it and get this logjam, unblocked at the earliest possible opportunity.
Mohammed Yassin.
Thank you, Madam Deputy Speaker. It's a pleasure to follow my honourable friend for Middlesbrough. And I would like to pay tribute to Right Honourable Member for Hemel Hempstead for bringing this hugely important debate to the Parliament. Families of severely ill children and patients who had lived for years with conditions which meant a life of extreme pain, with conditions like MS, believed they had been offered a lifeline when the Home Secretary rescheduled medical cannabis so it could be prescribed to patients who needed it. 6 months on, hope has turned to despair, as we are now in an unconscionable position whereby medical cannabis has been legalized, but it is almost impossible to access. It turns out that the policy change last year has so many ifs and buts and is steeped into so much bureaucracy that it is not yet worth the paper it was written on. The public is understandably bewildered and confused, as we all have heard that stories of parents who only want to protect their children from severe pain being denied life-saving drugs or had them confiscated by immigration officials. While the NHS and the medical professions are having arguments over what constitutes evidence for who is eligible for the drugs, children and patients are needlessly suffering every day. It is a shameful situation, and the government defense, as it's so often the case, is to say it's nothing to do with us. They have distanced themselves from implementation of their own policy and outsourced the tricky bits to those on the front line who have been given little support or guidance. Madam Deputy Speaker, in doing so, they have left so many people down. They have left seriously ill patients to fend for themselves, to be pushed from pillar to post, unable to find an NHS clinician willing to prescribe the only meds that control their seizure. The campaign group End Our Pain, who are supporting over 20 desperate families of children with intractable epilepsy, are having to help fundraise around $2,000 a month to finance trips abroad to get access to medical cannabis, which their children need. This issue has nothing to do with illegal drugs. It is not a Home Office issue either. It is public health issue. More than that, it is humanitarian issue. The evidence is clear. Certainly, to the parents whose children are alive because of CBD, that the benefits outweigh any negative effects. So why are patients still cruelly suffering? Instead, parents and patients are being criminalized, forced to go abroad, or order off their dark web to get hold of the life-saving medicines they were promised they would be able to access legally. I realize the importance of proper regulatory development process to coincide with the new policy, but why is this taking so long?
The Honourable Member, allow me.
I'll be back.
I'm very grateful, and I think he's making a powerful point about the ineffectiveness of the new regulatory regime that we have and how it's not working for families. I have a constituent called Georgia Emerson, and many campaigning members across the House will have met her father, who's in the public gallery this evening. He was one of the first to receive a prescription under the new regulations. It has to come from a private clinic. It costs him exorbitant amounts of money, and even then he has to pay to fly to London to get it because he can't cash the script in Northern Ireland. So even when operating the system's not working for Mr. Emerson or his daughter.
I absolutely agree with my friend who made a very powerful point here. That's why we are here today debating this and urging the government to take urgent steps and make this these drugs available for the children who are suffering, and we can save their lives by legalizing them. So the evidence-based and research surrounding the new policy must be called in and disseminated as soon as possible. And the barriers to clinically sound prescribing must urgently be addressed, including any training and support for prescribing doctors. Yes, we have to get the policy implementation right and safe, but it's cruel and unjust to keep patients suffering while the government hides behind a wall of red tape. Thank you.
Lloyd Russell-Moore.
Thank you, Madam Deputy Speaker. We have heard some really rather touching and heartfelt speeches this evening, and I suspect I cannot do justice to some of what we have heard. What I will start to say is I am incredibly sceptical about the use of cannabis in a recreational sense. But whilst, of course, condemning actually the current policy of criminalisation that we have. I'm sceptical about moving towards a recreational sense yet, but I am very in favour of us moving towards a proper normalised relationship with cannabis and cannabinoids in our health system. And I think actually the cruelty of what happened last year is that we dangled hope in front of lots of people's faces. Children, of course, who led, and their families who led this campaign, but also many adults that are suffering very long-term pain conditions and other conditions that would be helped by this. And we said it would be available for you. And then through administrative burden, deliberately or via cock-up, I can't quite tell, we have created a system where the barriers are so high that the drugs are not being prescribed. And part of that problem is that the rescheduling actually hasn't been sufficient. The rescheduling hasn't normalised cannabis and cannabinoids to a level of even opiates. It's given these extra conditions that clinicians have to jump through. They have to know that no other drug can work. You have to have tried every... I'll have to give way.
I thank him for giving way, I'm very conscious of my constituent, Darren and Danielle Gibson, and their young daughter Sophie, and I see the Minister in his place, by the way, and we are greatly indebted to him for his cooperation and help. But there, oh, sorry, in the House, not in this place. Sorry, let's keep it right. And there were many memorable moments in the fight for Sophie's medication, coming to terms with the differences in Northern Ireland and the mainland, jumping through the hoops in Northern Ireland as well, and then liaising with the Minister to fight my constituent to get what she needed in time, being rushed to intensive care. But here's the story, Madam Deputy Speaker. That young girl today is in receipt of medicinal cannabis. Her epileptic fits are reduced down to 1 per month. She can attend school again. She can be and have all the recreational things with her young friends at school and in the playground that she never had before. It happens, it can be done, it changes lives.
It can be done if it is given to patients at the right time and in the right manner. But part of the reason that I think possibly clinicians are nervous about this is that additional thresholds have been put on the prescription of these drugs, and that of course then means that there is an extra nervousness, and particularly when it is a new drug, and particularly when you're requiring it to be based on already pre-existing proven evidence. Now, I mentioned earlier on around in other life-threatening diseases such as HIV, but also in other times we have changed and relaxed and modified the rules around testing. And that was not done immediately, I must say. Those who remember will remember a vociferous campaign from people, particularly in America, but also here in Britain, around the folly of this requirement for pre-existing medical knowledge. And the shift was to look at harm. What is the harm done to not trial and not implement anything versus what is the harm done of any potential risks? And in this case, actually, we need to employ that kind of sense. And just like then, when actually it wasn't actually clinicians and it wasn't actually government that shifted on this issue, it was the fantastic work of campaigners. We see again how the fantastic work of campaigners, because they themselves need the drugs, or that family members need the drugs, are having to push this debate. And it is frustrating to some extent that we have not learnt the lessons of previous eras where this issue has been argued out. And in fact, the issue has been won on the side of prescribing time and time again. So why this time are we coming on the wrong side of the argument? What is it about cannabis that suddenly sets some kind of alarm bell off in either ministers' heads or civil servants' heads, that actually we create a system that isn't particularly conducive to prescribing? Now, we also see a situation which I find absolutely bemusing, where for some reason private prescriptions are acceptable, and others have talked about it, seem to be getting through if people can raise the right amount of money. But our NHS is not able to reflect that. Now, whether that is a consequence of cuts and an NHS that is at breaking point, or whether it is a consequence of where commissioners don't then want to prescribe these drugs, which would seem strange to me because the cost does not seem too high when I look at the figures, actually. It's cheaper than prescribing some other traditional medicines. So it would seem to me that it's not then an austerity issue that we know is a bigger problem in the NHS, that there is some other hidden problem, hidden force here, that means parents need to raise thousands and thousands of pounds to try and get private prescriptions and self-prescribe. Now, finish off on is to widen the debate slightly from children, which I think we have focused on quite rightly, to some of my constituents who are adults but also are in chronic pain. Because whilst it's quite right that sometimes through the story of a child we can push this forward issue, actually this could help millions, as we've heard earlier, maybe are self-prescribing already with cannabis. And actually that is not good for their long-term health. That is not good actually for the state of healthcare and their doctors trying to provide them holistic and round care can't fully do that if people are having to go off and self-prescribe elsewhere. United Patients Alliance is a very active organisation across the UK, but particularly in my constituency, and my constituent, one of my constituents, who's a 42-year-old man, in October '06 was diagnosed with complex regional pain syndrome. If he was given conventional medication, he is expected to take 10 millilitres of morphine a day, a huge of oral morphine a day, which is a huge amount. It means that his actual life quality is completely reduced. He is not as cognizant and he's not as able to interact and hold down a job. With his, with the head of pain at St Thomas's Hospital, he has discussed moving on to medical cannabis. They have even said that it would be a real possibility, but they believe the hurdles are too high for them to be able to currently prescribe him now. He is now resorted, of course, to having to get medical cannabis from other sources. Of course, to some extent, with his doctor or his clinician in complicity about this, creating a network of people having to almost lie and deceive the state. It is a bizarre situation that we end up turning, making people having to do things in hushed conversations rather than being able to record things properly in medical records. This absurdity must end. We thought it had ended. Now, my view is that the schedulisation of all drugs shouldn't be in the Home Office anyway. They should be in the Department of Health. It makes no sense for the scheduling to be anywhere near the Home Office because scheduling should be based on medical evidence. The Home Office should decide on classification, of course. But then, on top of that, the Department of Health needs to make some real moves very quickly to demonstrate that it hasn't just been all hot words and big letdowns. Thank you, Madam Deputy Speaker.
Ronnie Cowan.
Thank you very much, Madam Deputy Speaker, and I'd like to extend my thanks to the Honourable Member for Hemel-Hempstead and Gower for securing this debate here today. Several speakers have been quick to explain that this is about medical cannabis, not recreational use. And within the context of this debate, that's quite correct. But the fact that we feel the need to explain that is a strong indication that there is in the wider audience a great deal of mistrust born through ignorance of what cannabis actually is. We even start getting confused when we differentiate between cannabis and hemp. What we have here is a mess of our own making. A plant that can be grown in the UK and indeed is grown already in the UK, but under licence from the Home Office. More about that later. A plant that is good for the soil that it grows in. A plant that almost every single part of it can be utilised to make biodegradable plastics, biodegradable cloth, and as we know, medicines. A plant that's been cultivated for thousands of years in various forms. So why do we have an issue with it? Why has cannabis been demonised? When we mention the word cannabis, why for the majority of people does it conjure up the image of somebody sparking up a joint, a spliff, a J, a doobie, a roach? Because in the 1971 Misuse of Drugs Act, this place got it horribly wrong. They fell in with the prohibitionist mantra from the USA, and they made a range of drugs illegal. Prior to that, we controlled their use, we tolerated it socially, and we prescribed them as required. It was actually called the British system, and it worked. No criminal gangs controlled the production and distribution. No escalation in violence to protect marketplace. No county lines, and a lot less corruption. And by that one incredibly clumsy act, we demonised the entire plant. I think today, if we were talking about medical hemp, a range of folk would be more open to the discussion. But because of one cannabinoid in the plant, tetrahydrocannabinol, or THC, we've ignored the other 100+ cannabinoids and remain ignorant to the benefits they can bring and how they interact with the endocannabinoid system that each and every one of us has in our own bodies. The lack of medical research in the UK has led to an entirely unsuitable situation. My frustration is that we seem to be in no hurry to clear it up. Why are we not moving heaven and earth to licensed products that are used widely in other countries? Today across the UK, people are suffering needlessly. The medicines exist and are being prescribed and used elsewhere, but the UK government's attitude is that nobody knows better than us. We now find ourselves in a position where we're being forced to fight this issue one case at a time. We brought Alfie Dingley to number 10 to meet the PM. That seemed to make a difference. Billy Caldwell's mum brought the matter to a head by attempting to bring the product into the country. That moved things on too. And in their situation, wouldn't any of us do the same? Wouldn't we do whatever it took to gain access to medicine for our children? But we can't keep on fighting this on a case-by-case basis. That is cruel and it is heartless. And there are simply too many kids out there that could benefit now. And I apologise. I apologise to the many people that suffer with arthritis, multiple sclerosis and cancer. Because we don't shout about them as much. They need to be listened to. The sad fact is this government has shown that it takes the heartbreaking cases of kids with epilepsy to bring them to the table.
My honourable friend give way on that point.
Certainly, sure.
I wonder if my honourable friend could confirm my understanding that of the 10,000 people with MS who could benefit from cannabis for medical use, nothing has changed since November the 1st, 2008, when the government made it legal for specialist doctors to prescribe cannabis based on all products. Am I correct in thinking that's true?
You're absolutely correct. I'll just grab my briefing from the MS Society here, which illustrates that point. The MS Society has said to me, since Thursday, 1st of November 2018, nobody with MS has so far benefited from the change in the law, and access to cannabis-based medicinal products remain very limited. This includes access to Sativex, a licensed product. But of course you can get it if you can spare £500 a month to get it privately. As I've said, this system is cruel and it is heartless. Let's look at one example of how stupid our current laws are and how damaging they are to patients we're supposed to be helping. If you have a child suffering from certain forms of epilepsy, then there is good evidence that a cannabis-based medicine called Bedrolite may be of great help to your child. Any parent or guardian in that situation would want access to Bedrolite. I know of one case where a child is having 16 seizures a day and is now on Bedrolite. As of today, that child has been free of seizures for 50 days. Can we begin to imagine how great that is for the child and for his surrounding family and friends? But his supply is running out. As the mother of that child said to me yesterday, I can't let my boy get sick again. But what has she got to do to keep her boy well? The good news is, the UK, you can get bed relight if you are rich. If you are rich, or you can fundraise, you can go to a private clinic and pay for a prescription, and then pay £560 per bottle. And for one patient that I know, that equates to £28,000 a year. And that's not the most expensive case that I know of, not by a long way. I can quote cases that will cost twice that much to medicate their children. Or if you're prepared to break the law to provide medicine for your child, you can travel to the Netherlands and purchase bed relight for £167 a bottle, therefore reducing your annual cost to £8,100 a year, plus travel and accommodation costs. But you risk being arrested and separated from the child that you're trying to help. I know of a case of a wee boy in Scotland whose mum has brought back oils illegally from the Netherlands. He recently went through a bad spell of cluster seizures. Normally he would be in hospital, unconscious, unable to walk, eat, speak or swallow. This time he's remained at home and has not needed any rescue medication. His mother should not have to pay thousands of pounds a month and break the law in trying to help her sick child. It's no wonder that scammers have moved into this marketplace, and as a parent of a child wrote to me yesterday to explain, the vultures are preying on the very vulnerable, desperate families and selling fake or non-filtered oils, which is unsupported and also very dangerous. And this gives us another problem. While we sit back and do nothing, scammers will move in, criminals will move in, people will say, I'm buying a product, it's cannabis, but it's not doing me any good. And then the government will take another step back and say, well, the evidence simply isn't there. Or your last option can be to do what the government has said you should do. To access medical cannabis, you must have tried medical cannabis and experienced benefits. But as I've pointed out, that involves either a lot of money or breaking the law. That's what the government's asking parents to do. You must have exhausted all other drugs, despite knowing they don't work and have got many dangerous side effects. We're asking people to endure side effects and disappointment to justify their request. And once they've done that, they find their GP can't prescribe under the current system, and that specialists are reluctant to, as they are going to be going out on a limb, and they fear reprisals from the medical community. So what we have is a situation where the UK government says we have a system and absolves itself from the responsibility and the duty of care to the citizens of the United Kingdom. And I was going to ask the Minister if she could explain why we treat any, if we can't treat any cannabis-based medical products as Schedule II drugs under the statutory instrument where it's been prescribed by a medical practitioner in another jurisdiction. But of course we've got a Health Minister in front of me today, not a Home Office Minister, and yet again this problem falls between two stools. Home Office or Health Office? Who's going to take responsibility for this and move it forward? Because while we delay, the privatised UK cannabis business grows, and the privatised pharmaceutical companies are controlling the available product with an iron fist. It looks like we are restricting the provision of medical cannabis while we evaluate a marketplace and develop products with the intention of making a lot of money out of it. The government wouldn't be that cruel, would it? Not deliberately. The government doesn't have a vested interest in the pharmaceutical industry, does it? It's not granting licences to its pals to grow cannabis or encouraging family members to invest in pharmaceutical companies with a vested interest, is it? Surely not. But of course we know that it absolutely is. And that's the backdrop to the photo opportunities and the sympathetic words of staged understanding from government ministers. Unless you have a child living with these circumstances, then you can't possibly understand the need, the frustration and the anger. We as politicians are elected to listen to the people, and the parents and the guardians of these young men and women are screaming at us. Give us access to affordable, legal medication for our children, and do it now.
Julie Cooper.
Thank you, Mr Deputy Speaker. This has been a very powerful and emotional debate that, as I know, moved members on all sides of this House. It's been a debate characterised by anger and exasperation on all sides. I'd like to thank the Backbench Committee for selecting this subject for debate, and I'd like to mention my former, much respected colleague Paul Flynn for the excellent campaigns he ran on this subject, and I know that somewhere he'll be cheering us on, and I hope that by at the end of this debate, when we hear the Minister's comments, he's got more to cheer about. I particularly want to pay tribute to the Right Honourable Member for Hemel Hempstead and my honourable friend, the Member for the Gower, for their unflinching commitment to this cause that does them credit. Thanks is also due in no small part to the all-party parliamentary group whose dedicated purpose is to help secure access to medical cannabis in the UK under prescription from a medical professional. This group has worked tirelessly to this end, highlighting the barriers that exist and posing constructive suggestions to remove these barriers. Mr Deputy Speaker, as the member for Reigate mentioned quite rightly earlier, we are not concerned here today with criminals and illegal drug supplies. We are not concerned with the use of recreational drugs. We are today considering a most important health issue. And I welcome the fact that at long last the government accepts that the therapeutic use of cannabis is a public health issue and not the business of the Home Office. I trust that going forward, therefore, we will never again see parents in possession of medicinal cannabis products accosted and treated like criminals. I refer, of course, to the disgraceful treatment meted out to Tegan Appleby's family. Cannabis has long been known to contain active ingredients that could have therapeutic use in the treatment of many conditions, including muscular dystrophy, Parkinson's disease, Crohn's disease, cancer, AIDS, sickle cell, and many more. International research and real-life experience here in the UK has shown that the active ingredients, CBD and THC in combination, can provide relief for these conditions. And there are strong indications that these medicinal cannabis products can have a transformational effect on paediatric epilepsy cases. We have, though, in the UK been very slow to accept this and even slower to act to help those who could be helped. Other powerful drugs with significant street values, drugs such as heroin and diazepam, have long been available on the NHS under the supervision and control of qualified clinicians. Such drugs are extremely harmful in the wrong hands, but subject to the existing controlled drugs regulations, these products can be used beneficially. In recent years, we have made some progress, and we have begun to accept that cannabis could and should be used in the same way. This changing attitude has most definitely been driven by increased public awareness of the suffering of individuals, many of them children. Members today...
And just to reiterate exactly what the Honourable Lady is referring to, my young constituent Sophie has not been hospitalised and has an active seizure in 10 months. And I could her mum. Our little lady just amazes us every day, and we are very blessed to be in this position, but we can't help but think of the thousands of other children and adults that could need this right now. So does the Honourable Lady agree we must also ensure that we are making progress? This debate is about progress and moving forward. It's important for the Minister to do just that.
I'm grateful to the Honourable Gentleman for his intervention. I absolutely agree with him. There is the potential to help thousands, and we must move forward at the earliest opportunity. Members have raised some very powerful cases on behalf of their constituents today, adults and children who could benefit. I want to mention the experiences of the Griffith family. Mrs Griffiths asked me to help her 9-year-old son, Ben. Ben suffers with severe intractable epilepsy. This means that he has up to 300 seizures a day and has come close to death on more than one occasion. At the new year, Ben was admitted to Alderhay Children's Hospital, where during an 18-hour period, he was observed to have 200 seizures. Ben's parents asked if he could have access to CBD and THC, but they were informed that Alderhay has a blanket ban on medicinal cannabis products containing THC. Ben was discharged, and his discharge letter stated that his parents had asked for an illegal drug. In desperation, the family have turned to a private neurologist, and thanks to him, since January of this year, Ben has been taking medicinal cannabis, CBD and THC, and his condition is much improved. Yesterday, he only had 4 seizures. His family tell me that Great Ormond Street Hospital and Professor Finbar O'Callaghan, the head of the BPNA, have acknowledged Ben's improved condition, but the family are still unable to get an NHS prescription to supply the medicinal cannabis Ben needs. The private prescriptions for his treatment are costing the family £2,500 a month. Mr Deputy Speaker, the family cannot continue to fund what is for Ben life-saving medication, and they fear they will lose their son. Mrs Griffiths asked me, how sick does our child have to get before the NHS will help him? And I know that's a question that will go to the heart of everyone in this chamber today. And what we are seeing here also in relation to the high cost of private prescriptions from this medication is the development of an unjust 2-tier system where those who can pay get access to vital medication and those who can't pay go without. This is totally against the very principles of the NHS of which we are so proud. In July 2018, the Chief Medical Officer published a report declaring there was conclusive evidence of the therapeutic benefits of cannabis medicinal products. And she recommended that the whole class of cannabis medicinal products be rescheduled under the misuse of drugs regulations. The Home Secretary listened, and on the 1st of November 2018, the government took action to reschedule cannabis for medical purposes. This was a very welcome step forward, and it made it legal for doctors on the specialised register to prescribe unlicensed whole plant cannabis products for medicinal use in the UK. On that day, hundreds of families across the country celebrated, believing that this meant they would have access via the NHS to medicinal cannabis. Sadly, this has not been the reality, and not one single NHS prescription since has been written for a whole plant medical cannabis, and the hopes of many have been cruelly dashed. Ironically, changing the legal status of medicinal cannabis has actually made the situation worse. Prior to this change in legislation, the Home Secretary had the power to grant special licences to make medicinal cannabis available. Home Secretary no longer has this power, now supplies a conditional on both clinical sign-off and a funding agreement, and this is not happening. I know that the Minister and the Secretary of State want to resolve this problem. I know that the Secretary of State has met with some of the affected families and he's promised to help them. But, Mr Deputy Speaker, the clock is ticking, and the End Our Pain campaigners are absolutely clear that this is a matter of life and death. It's now 2 months since the Secretary of State met families, and in that time, crucially, not one single NHS prescription has been written for medicinal cannabis that contains both CBD and, crucially, THC. There are many good intentions, but the Department's implementation procedures following the reschedule of medicinal cannabis are not fit for purpose. The Secretary of State has said repeatedly that he cannot overrule the judgment of clinicians, and of course we do not expect him to do so. We do, though, expect that he recognises that these are exceptional circumstances of great urgency, and urgent special action is required. It is clear that the procedures are not working, and we cannot rely on a business-as-usual approach. As my honourable friend, the member for Manchester Wythenshawe said, we need a bespoke solution. We need an acknowledgement that cannabis is a special case. We need a broader analysis of the evidence for the efficacy of medicinal cannabis that brings together worldwide research together with the experience of patients and families in the UK who have benefited from using medicinal cannabis. While the NHS England investigates the causes of blockage in the implementation process, we need the NHS to step in to meet the costs of private prescriptions. We need improved education and support for medical practitioners with regard to medicinal cannabis, and the current guidance for prescribing medicinal cannabis needs to be changed to support and protect prescribing clinicians who prescribe following best practice in the best interests of their patients. We need the Department of Health and Social Care and the NHS to stress that medicinal cannabis is legal, and there is an expectation that it will be prescribed in the same way as any other unlicensed medicine when appropriate. And we need a guarantee on funding. We need to know that everyone right across these islands, wherever they live, whichever CCG governs their health care in their community, has access to funded products where appropriate. Mr Deputy Speaker, good intentions on their own are not good enough. We need urgent action. Thank you.
Seema Kennedy.
Thank you, Mr Deputy Speaker. And this has been a very moving and important debate. It touches on a matter which I know from my own constituency and which has been outlined with such passion by honourable members on all sides, which leads to great distress to patients and their families, and honourable members have spoken with great passion this afternoon and this evening. I want to recognise the deep frustration of families, and that has come across very strongly this evening, and the patients and their parents, and all of us who are parents or all of us who have cared for a loved one can empathise with them. I want to start, before I mention the movers of the debate, to pay tribute to the honourable gentleman, the member for Middlesbrough, and his wife Sally, who shared their experience with us. It's them and parents like them that we will be concentrating on this evening. But it would be remiss of me not to mention my right honourable friend, the member for Hemel Hempstead, and the honourable lady, the member for Gower, and all the work they've done on the all-party group, and for their tenacity in keeping this issue on the agenda. Many points have been raised. There's been great frustration expressed to me, and that has been heard on the front bench, and I will be speaking to the Secretary of State again and taking back all messages to the officials. I will try and answer the points of debate as I go through my remarks now. The law was changed in November last year to ensure that doctors on the specialist register of the General Medical Council can legally prescribe cannabis-based products for medicinal use in the UK. It was right that we put these decisions in the hands of clinicians, because they are the ones with the best knowledge of all the treatments which are available to treat conditions that they are specialists in. I and the Secretary of State have been clear that whether to prescribe must remain a clinical decision to be made with the patients and their families, taking into account the best available international clinical evidence. And I want to reassure colleagues that we are in close contact with colleagues in other countries to make sure that we do learn from their experience. And when clinicians make these decisions, it's about taking into account the circumstances of each individual patient. And it's not for me as a politician to second guess or pillory their decisions. And I was very alarmed to hear my honourable friend, the member for South Suffolk, saying that doctors are being trolled for some of the decisions they are or are not making. They have the best interests of their patients at heart, and their primary focus is to do no harm. But of course, we do not have the optimal system in place yet, and I recognise that. And it's undesirable that patients are travelling abroad, and the Secretary of State and I are determined to do everything we can to make sure that patients can obtain medicines in this country if it's medically appropriate. There are already systems in place to do that, and I want to do everything I can to understand why patients are not using the systems in place to access them here in the UK. And we want to continue to refine these systems so that the demands of the patients that want to try medicinal cannabis are balanced against other demands on NHS funding. Given the embryonic state of the evidence based on effectiveness and cost effectiveness of medicinal cannabis, it's not easy. However, we are working hard to make sure we get this right, and this is really crucial. And my honourable friend for Reigate, and he and I have had many discussions about this, and he spoke with great passion. He mentioned what we do to get more evidence, and he also raised the issue of growing a market, and we will explore this issue with the Department for International Trade. I just wanted to pick up on a point that the Honourable Gentleman for Henley mentioned, which was about the number of prescriptions that have been made since November of last year. Data shows that until the end of February, there have been 6 items issued in the community. I think he thought there were none at all under NHS prescription. Yeah. I'll give way to the Honourable Gentleman.
Because the evidence from the families and your parliamentary group that I represent, co-chair, excuse me, is there's only been 2. So if the Minister knows of 6, we'd love to know not the individual case, but where those other 4 have come from, because the families are confused, because at the moment we only know of 2.
That's my information is that there are 6, and I'll happily write to the Right Honourable Gentleman with more information. As the House heard last month, my Right Honourable friend, the Secretary of State for Health and Social Care, has met with many of the families and of the patients that honourable members have raised today, either through their work on the group or through their constituencies. And all of us could not help but be moved by the distressing cases and the continued efforts of those who support them. The Secretary of State has asked NHS England to conduct a process review to identify any inappropriate barriers to clinically appropriate prescribing. I'm pleased that this review is underway, and NHS England is working with my Right Honourable friend, the member for Hemel Hempstead, the all-party parliamentary group on medical cannabis under prescription, and patient representative bodies to help identify cases that might best illustrate the experience of a range of patients.
We have lots of time, so this is very generous, we're giving way. Can she confirm when the interim report will be issued on the blockages and when the final report will be made to the Secretary of State? It was indicated to us at a meeting with NHS England only last week that there will be an interim by the end of May and a report to the Secretary of State in June. Would the Minister like to confirm it?
I will come to timelines later in my remarks. NHS England are currently obtaining patient consent and scheduling the necessary interviews, and the first interviews were held today. And these were between clinicians, decision makers and their patients. I just wanted to touch briefly at this point on devolved matters that one of the SNP members raised. Of course, health is a devolved matter, but officials across the UK have been working closely on the development of this policy. The law is exactly the same in all 4 countries of the UK, and only funding is devolved. And the training package, and of course honourable members have talked about how clinicians might be nervous about this, about prescription, and we need to improve training, and I will come to talk about that later. Can I just finish this, if the Honourable Gentleman will allow me? The training package that's been commissioned from Health Education England will be made available across the UK. And I'll happily give way to the Honourable Gentleman.
The Minister has heard my comments on behalf of my young constituent, Sophie Gibson, and the Minister will know that she is getting the medicinal cannabis through the trust area. Can I suggest to the Minister that maybe, if that's how it's done in Northern Ireland for my constituents, it could be done for other constituents across the rest of the United Kingdom through their trust areas or the NGOs, wherever their responsibility lies?
Minister.
I think I thank the Honourable Gentleman for his comments, and of course, in terms of prescribing, that is in the hands of the coalition. Whether the prescription is paid for, that is a matter that's ruled on locally, and again I will come on to talk about that later. But the report, as to indicate to my right honourable friend, and including any recommendations, is expected shortly. And we will consider carefully any further action we might take to improve access in the light of this report and the clinical guidelines that are due to be issued by NICE. Members are rightly frustrated with the slow pace because of the distressing cases that are, and because examples that they've seen from abroad. NICE guidelines have been expedited. They would normally take 2 years to produce, and when they come out this autumn, that will be half that and only 1 year. Honourable members have said that patient expectations are not being met, and the challenge that, and people have said that clinicians are taking an overly cautious approach. With new medicines, we need a strong evidence base, and this is still in development, and of course that is partly because of the historical overhang. I was about to reference him, but yes, I'll let him speak for himself.
It's the point I was, he's probably picking up the point I made, Ryan, right? It's about the risk-reward ratio here, about the assessment of this. That humanity has some, goodness knows how many thousands of years of use of this plant. It was made by others, and it may need a different risk-reward assessment base rather than the classic medical variety, which of course is sitting with thalidomide in the background for all the people who regulate our medicines, of their anxiety about what might happen. We might need a different framework for this.
Minister. Well, the honourable gentleman raises an interesting point, as he always does. These are new, so the normal NHS medicines governance systems apply, and they are being used to support good clinical practice and safe and effective prescribing. But of course, we could do more to educate and support the health profession. I just wanted to pick up at this point on another point that my honourable friend for Henley raised, which was about who does the prescribing of these medicines. These are not frontline medicines. It's right that specialists who have detailed knowledge of all the treatments available for these particularly difficult cases are the ones that should be responsible for prescribing. Cannabis-based products would not normally be considered until a patient was at the stage in their treatment pathway when they were under the treatment of a specialist. On education, Health Education England have been commissioned to develop an online training package. The aim of the package is to familiarise those working in the health sector with the change in the law and straightforward information about the products and what is known about their mechanisms of action. It will support and underpin the knowledge and understanding gained by specialists as experience in prescribing these products grows. Oh, yes, and then I will talk about the evidence.
Thank my old friend for giving way. She's been very generous with taking interventions this evening. In her remarks, she sets out the risks, but can I also pay tribute to her and the Secretary of State, who have not simply looked at all the risks and all the roadblocks that medics put up, but have said how important it is to produce answers, solutions, and take things forward. And so can I urge her and the Secretary of State to continue in this excellent work in making sure that progress is made and to continue to push forward.
Well, I thank my honourable friend, and that's why after the urgent question that we had last month, the Secretary of State did issue the process review, and as I've indicated to my right honourable friend who brought the debate, that will be reporting shortly. We can't be sure that cannabis-based products are safe or effective. There is a body of anecdotal evidence of therapeutic benefit, and the Chief Medical Officer concluded that the evidence was sufficient to recommend that these products be considered for rescheduling from Schedule 1 to Schedule 2 of the misuse of drugs regulations, and their medicinal benefits be further examined. All products in Schedule 2 can be prescribed. Cannabis-based products for medicinal use are no exception. I just wanted to talk quickly about the evidence base, because some people have talked about randomised controlled trials, which is what we normally use as and anecdotal evidence. And of course there is, as honourable members have indicated, that parents are arbiters of this. Normal procedure is we don't base prescribing decisions on anecdotal evidence, but this is why we've asked NIHR to stimulate further research, because we need to build up the existing evidence base, including the observational trials.
Thank you. I'm grateful to the Minister for giving way on that point. But does she accept that these are not normal circumstances, that these families and these parents are absolutely desperate to access medication that they have seen work for themselves? And can she find some way to circumvent the usual processes?
I recognise the deep pain that families are going through, and I do take the point that of the great frustration and desperation of the families. What I would say is that we have asked for more evidence, and we are working with everybody necessary to try and get this done as quickly as possible. And NICE is, can I just finish on this point, please? NICE is internationally recognised for its robust and evidence-based evaluations and guidelines, and I'll give way to the Honourable Gentleman.
I'm just wondering, I've got two families whose children are both suffering from epilepsy. They're taking Bedrolite today. They know it's beneficial for their kids. It's anecdotal evidence, but it's in their house. They can see it working. Both prescriptions, both the sources they have will run out in June and in July. Can you tell me what I have to say to those parents when their kids' prescriptions run out?
I don't feel... well, I don't feel able to comment on a specific issue when I'm not a doctor or a clinician or a scientist. I'm happy to, of course, as a parent, but again, I'm not a doctor and I'm not here to make that call. What I would say is I'm very happy to meet the Honourable Gentleman to get more of the facts that he's presenting to me. What is needed to support such prescription is evidence of efficacy, and for public funding, cost efficacy. This is the system we apply to all medicines and medical devices in the UK. Cannabis should not be treated any differently. The current evidence base has been summarised by the professional bodies in their interim clinical guidance and will be further examined and reported on by NICE shortly. Yes, of course.
Thank the Minister for giving way. I have one question for the Minister, which is, has the cost analysis been done on a particular case? When I spoke earlier, I spoke about Alfie Dingley. It would be very interesting to see the impact of his actual case financially, the benefit that is gained to the NHS and the money that it has saved the NHS since he has been taking the drug.
I apologise to the Honourable Lady because she did ask me that, and I'm afraid I forgot to send a note to the box, but I will be happy to write to her to see if that analysis has been done. Many honourable members, including my honourable friend for South Suffolk, talked about funding. These are local decisions with clear local procedures for making funded decisions, and the process review is looking at this, and as I've indicated, it will report shortly. And I call upon the industry to invest in more trials, publish the results and the full underpinning data, because we all want to see licensed products that doctors can use with confidence. And where there is supporting evidence, the government and the NHS will work with companies to make the products available. And indeed, over 110 patients are now being treated with a pure CBD extract product, Epidiolex, which has been referred to by numerous honourable members this evening, on an early access programme ahead of a licensing decision by the European Medicines Agency. In developing a licensed product, the evidence has been generated on the safety profile and effectiveness of the product. It is this that provides both clinicians with the confidence to prescribe and the system with the evidence it needs to make decisions on routine funding. The NHS does not routinely fund any new medicine until it has been through a process of evaluation to ensure that it is safe, effective and represents value for money. And on another point that the Honourable Lady, the member for Gower, brought up, which was about one of her constituents going on the Epidiolex trial. I think she brought that, yes. If she would write, what I would say is that the specialist centres around the country are referring patients to DW Pharma, and there are certain criteria and there's a number of places, but if she'd write to me, I'd be happy to meet her and we could discuss that further. We need to develop our knowledge base further on these products. That's why good quality clinical trials are imperative. We need to know more about the scale of benefit of cannabis products across a wide range of indications. We also need to understand how this compares with existing treatments and indeed other promising new drugs that may be as effective. I will, and then I will conclude my remarks.
Very grateful. And on the point of trials, she's obviously aware of, if you take Epidiolex, this is a CBD-based medicine. There are many parents who believe, based on their anecdotal experience, that those compounds don't have as much impact on reducing seizures as those which contain THC. So can she assure me that the trials we have will look at THC-based products as well?
I can't say what's going to be in the trials because I'm not a scientist running them. All I would say was we've made the call. We want everybody who can to take part in the trials so that we have a much fuller picture and we can get to a situation where we have licensed products that doctors in this country feel safe prescribing. So I would conclude by thanking all honourable members who've taken part. I think it's been a very, very useful debate. It is a very extremely difficult area. There are heart-rending cases which honourable members have spoken of very, very movingly. I hope that I've shown that government takes this very, very seriously. We're committed to ensuring the policy is implemented in a safe and sustainable way, making cannabis-based products available to patients where they're clinically appropriate.
Mr. Deputy Speaker, and not only was I enormously proud when I went before the Backbench Business Committee and asked for this debate last Tuesday, it was a bit of a shock to get this afternoon and this evening. But at least we haven't had to go home early and we've had an absolutely brilliant debate. I'm not sure, to be honest with you, Minister, how far this has taken us. I fundamentally have an issue around the fact that we've got families and children that through crowdfunding or whatever other way they can fund it, remortgaging in some cases I understand, are getting this drug perfectly legally. And there are consultants and specialists that are qualified to do so that are issuing prescriptions on the NHS and they're not being honoured. That is something that the Department of Health are wholly responsible for. There are other issues to do with the Home Office, I fully accept that. But for people that have been marched up to the top of the hill, and I accept for many years when Paul Flynn was campaigning on this and the government was a different colour and it didn't happen, and it didn't happen because it was in the too difficult pile called Schedule A. We're not in that position now. We are in a position where this House, and we've debated it now for like 4.5 hours, Mr. Deputy Speaker, can tell the country and tell the government that what is going on now, well, if you can afford it, you can get it, and if you can't afford it, you can't, has to stop. And this government has to stop that. I know how difficult it is. I was the Minister in the Home Office when this was discussed. I was the Minister that stood at the dispatch box. I know the blockages. I've sat with my co-chair, the Honourable Fagawa, with the NHS, with the Chief Pharmacist. We know, but we need to unblock. We need to believe that the NHS, free at the point of delivery, is going to deliver for these young families, and the chequebook isn't going to win. I'll tell you now, Mr. Deputy Speaker, I will raise money in crowdfunding. I'll do anything I possibly can. But we shouldn't have to do that. The medical evidence is there from other countries. We're going to have to make exceptions, as the Honourable Gentleman raised on the other side, because it's different. You can't put one of these children on a placebo because you know it's going to make them really ill when they withdraw from what they've been given already. The children that have been given this product, and some now adults, in my particular constituent's case, need to have confidence going forward. They don't need to beg, borrow and steal to get their lives put back on track, and in some cases not fully on track, because it won't be. This is not a cure. This eliminates some of the conditions in some people and for some conditions. And we really don't know the full conditions yet, because as the Minister has said, we have to do more work. But in this specific case of paediatric epilepsy with seizures, it appears in some cases, and quite a lot of cases, that this pharmaceutical provided prescription cannabis oil makes a difference to the quality of people's lives. And we were sent here, Mr. Deputy Speaker, to make a difference. Not to chat around for the sake of it, to make a difference to people's lives. And I hope that's exactly what the Minister will do. And finally, Mr. Speaker, Mr. Deputy Speaker, I've preempted myself there. Fraudulent slip. I clearly won't get another UQ for a while. Mr. Speaker said to the Secretary of State for Health that we will persist. He was referring to me, but I actually say on part of the parliamentary group, where over 100 members. This is what this House is good at. If we get it right, it's very good here. And this debate has been excellent this afternoon.
The question is, as on the order paper, does many of that opinion say aye? Aye. The contrary, no. I think the ayes have it. The ayes have it. We now move to motion number 3, business of the House. Minister to move.
I beg to move.
The question is, as on the order paper, does many of that opinion say aye? Aye. The contrary.